Okay, welcome back. The next thing we're going to have is a update of a program that happened back when we funded back in September. But Rick, I'll turn it over to you to finish the introduction.
Okay, thanks very much, Pat. Can everyone hear me okay?
Yes.
Okay, good. Well, let me kick off this next discussion by noting that NAEHS has developed and sustained a strong base of children's environmental health research projects over the past 20 years. Hopefully that's all apparent to you on council, at least not the new members, but at least the existing members. And we've done this through, basically the unsolicited research grants. And most notably, we've done this through this landmark NAEHS EPA Children's Environmental Health and Disease Prevention Centers program. So this collaborative program with the EPA, it's over now, but for many years it supported the types of transdisciplinary research teams that were needed to produce data on how to address the major challenges associated with the protection of our children at the local, regional, and national level. So as you may recall that in 2019, the ERT staff brought to council a concept to establish a new children's environmental health program, but this time focused on translation. And this was important because our second theme of our strategic plan is about translating the basic research, the research findings that we generate. So we expect that this new program will facilitate the movement of research findings and put them into practice through the development and the implementation of tangible tools, methods, messages, and activities that were ultimately designed to protect and improve children's health from harmful environmental exposures. So today I would like to introduce two members of our staff who you all know, Kimberly Gray and Lindsay Martin. They're both from the Population Health Branch, and they will officially kick off this new program. They'll start by reminding you of the purpose and the structure of this new center program, and then they will welcome each of the center awardees for a brief presentation of their proposed translational activities. So let me hand the virtual podium over to, is it Kim first or is it Lindsay first?
Yes, Kim first.
You're on, Kim.
Thank you. Lindsay, you want to advance the slides, please? Thank you. So thank you, Rick, so much for your generous introduction to our program. Kind of give you an overview already of what we're going to be doing here today, give you just a really brief overview of how we got here. And then I'm going to hand off the leadership here to Lindsay Martin, who's really going to explain the structure and function of the program. And the most exciting part about today is that you're actually going to hear from the center leadership and not just from program, where they're going to tell you what their plans are for the next 5 years and vision for this translation center, which is collaborative in nature. Next slide. So first, we can't go anywhere with first acknowledging this really does take a village, raising these children's centers programs, whether it was working with EPA, working with NAEHS, because it's a lot of work. So first and foremost, our grants review. Linda Bass has been with me on this program since I started in 2002, but she's been doing this for many, many years. And kudos to her for her leadership of putting together and quite an exquisite panel under some really difficult times, because as you can remember, this is during COVID period. So we had some institutes up and running, some not, but I don't think the challenge of getting reviewers ever happens to Linda, because she has a village herself. Leroy Worth, who also participated and managed one half of the review. And then Kendra, I can't mention anything more about Kendra Morrison. She was so exceptionally gracious to us, and we had so many we had an application webinar, we had review webinars, and she kept us on time, and she got all the reviewers on and made it all happen. And then with grants management, with Jenny Greer coming on board, and management from Barbara Gittleman, who has been a part of the Children's Centers program, they really helped us work with this new mechanism and work with our investigators on how to implement it. And I couldn't get the FOA done without advice from Christy Pettibone as anchoring this in the translational framework, which she put out there in press and worked with the core centers on. And then with Ken Rule, who served as our peer review chairperson, and all the peer review members. This was a many-day, 4-day peer review panel with many webinars, and we're so grateful to all of you so that this actually can happen. Next slide. So I just want to remind you how we got here. And that really has to do with, back in 1997, President Clinton issued this executive order to really protect children from environmental health risk and safety. The executive order charged the agencies to really identify and assess environmental risk, ensure that policies and programs and activities and standards address this. So really, we were trying to make sound environmental decisions that protected our children, and it required a lot of information on who's exposed, how are they differentially exposed, and what are the harmful agents that we should be focusing on. And how we started this was a collaboration with our agency partner, EPA, and published the Children's Environmental Health Centers program in 1998. Next slide, please. So this partnership with EPA not only shared costs, it shared vision. We had to make sure that the science was both responsive to the needs of EPA, to the research gaps and translation opportunities that we saw at NAEHS. And it was a very long-term 20-year collaboration, and it was very fulfilling. And it ended with the publication of the NAEHS EPA Children's Center Impact Report that was led by EPA. Next slide, please. And this report really emphasized how the center supported the transdisciplinary teams and how they provided really demonstrable evidence that the approach for addressing these major health problems at the local and regional level really contributed to protecting children. And if you have time, we'll have the link to this impact report. We'll really give you some amazing stories to be told about the center's program and its legacy that will be had. And it focused not only on environmental exposures, but I just want to let you know that this also dealt a lot with the social factors as well as stress factors and other non-environmental factors that were contributing to health. Next slide, please. So as we mentioned that since the inception of the Children's Centers program, this really laid a strong foundation for a new way of thinking about children's environmental health and some of the issues that we were facing. So NAEHS has developed and sustained an incredibly strong base of children's environmental health research projects and infrastructure through other mechanisms outside of the Children's Centers program. So I'm going to remind you of what those are and what our base foundation is in children's environmental health. Next slide. So this is the funding over time in children's environmental health. And this is from fiscal year 2000 all the way up to 2020. Last time I presented this, I only had 2018. So you can see, although the Children's Centers ended in 2018, 2019, there's still an uptick in the foundation of children's environmental health research outside of the center's program. Next slide, please. As a snapshot for this year of our solicited portfolio, it's $54 million and a base of $66 million is unsolicited, which is a pretty large budget of $121 million in children's environmental health, broadly defined. This includes preconception to age 21. Next slide, please. Here are some of the activities that we have that really make up that 54 million targeted. We have the new Pediatric Reproductive Environmental Health Scholars Program that was kicked off in 2021. We're maintaining and enriching infrastructure of our environmental cohorts, and that program exists and will continue on as well. We have cohorts that are part of the Victor program, where those PIs have come together in a transdisciplinary way and form partnerships with others to explore from bedside to the applied research. We continue to have support from our NAEHS Cheer Now Here program to enhance exposure characterization of these cohorts. And then outside of NAEHS, we've really been able to leverage the ECHO program through our PIs who have created these children's cohorts and pregnancy cohorts. There's over 22 that are a part of that ECHO program and still are champions of looking at the environment and children's health. Next slide, please. So remember, there's still about 66 million currently that's still unsolicited. And we do know that scientific discoveries from the entire children's environmental health research is really met with great interest from our healthcare professionals, from the outreach from our community-based organizations. But a lot of times it's not embraced in the mainstream practice. So we really wanted to think a little bit broader and develop a program where children's environmental health could move the science from the shelf, from the research, to real world impacts that improve children's health. And this is how we came up with the next program. Next slide. So really our mantra was, what were we going to do with all this research that was existing outside the center's portfolio? And what good could we do with it, with all that research? And that's how we came up with the Collaborative Center. Next slide, please. So here's where I'm going to introduce Lindsay Martin, who was integral in getting this, this FOA published. Lindsay came here to Population Health Branch in 2020, right when we were writing the actual funding opportunity, and really helped craft a different lens to the program, where we really were capitalizing on her expertise in methodology and implementation science and dissemination. And so she's been a value contributor to the program and has seen it through to its publication. So Lindsay, why don't you come on board and walk us through the next phase of this presentation.
Thanks so much, Kim. So we were excited to announce that in June of 2020, the RFA was published, and we had a widely attended pre-application technical assistance webinar that September, followed by the receipt date in November of 2020. And so the overall goals of these new children's centers were to really increase collaborations and partnerships, to promote research translation, to accelerate translation of science to key groups, and to enhance and consolidate a network of children's environmental health experts. And so the purpose of these centers is really to facilitate interaction among children's environmental health scientists, communication, behavioral and social sciences, and dissemination and implementation scientists, as well as engaging partners to move the science into public health and clinical practice. It was also to synthesize and translate existing children's environmental health research into these tangible communication tools, dissemination methods, health messages, and education activities that can be used by partners, including populations and communities affected by environmental exposures, clinical and public health community partners to improve children's health. It's also to stimulate pilot projects to address emerging environmental health concerns and exposures, and test new tools, methods, and intervention and prevention strategies. So we wanted to share with you some of the eligibility requirements for this new program. And so there is a director that is a recognized and established research investigator in children's environmental health, as well as a deputy director that's an expert with a track record in health communication with translation of science to lay audiences, scientific community, and public health and medical professionals. Also, a strong base of children's environmental health research and subject matter experts that included having a collective history of funded research in children's environmental health from 2015 to 2018, as well as having a robust publication history in children's environmental health related fields, evidence of working with key children's environmental health partners, and collaborations with outside institutions and other children's environmental health researchers. And so we like to share with you the breakdown of these centers that includes the administrative core, that's really the managerial model of this center that oversees the responsibilities and commitments of key personnel to the Children's Center. They are also responsible for the evaluation and impact of the center and fostering a network of translational children's environmental health research. The Developmental Core is really responsible for developing new science and developing a robust career pathway of the next generation of children's environmental health translation research scientists. This also includes professional development opportunities and career advancement for the next generation of children's environmental health scientists, and a unique Catalyst program, which is a pilot project program to support emerging and time-sensitive children's environmental health issues. As you can see from the diagram in the center of your screen, the translation core is really the focal point of these centers. And these translation cores develop a translation plan to move existing children's health research into applied practice, support collaboration with fields not associated with environmental health science, such as the behavioral and social sciences, implementation science, and many others, and a pilot project program to test, implement, adapt, and evaluate new research and to quickly move these findings into practice. There is also one coordinating center that will be responsible for developing and maintaining a central web portal, promoting the centers to the research community, coordinating cross-center activities, hosting and archiving teleconferences and web-based interactions among the Children's Center PIs and staff. They will also be involved in the evaluation of the overall Children's Center program. So we sent the funding plan to Council in September of 2021, and 6 centers and 1 coordinating center were funded in December of 2021. And we are pleased to announce today that this is the official kickoff for this new program. And Zoom has given us the incredible opportunity to have the center directors join us for the next part of our presentation. And so the centers that are awarded include Oregon State, Emory, Johns Hopkins, Penn, NYU, and USC. The Children's Environmental Health Network will serve as the coordinating center for this new program. And I would now turn the virtual podium over to NSAE to kick us off the next 25 minutes. The center PIs will introduce themselves and their exciting activities that they have planned for their center. So NSAE, I'll turn it over to you.
Thank you so much. We are so excited. Insay Witherspoon, Executive Director of the Children's Environmental Health Network. And yes, it is nice to be back at council as a former council member. We are a national nonprofit that's been devoted to protecting children from environmental hazards, celebrating 30 years. So it's quite a wonderful timing as well to be announced as the coordinating center for this new era of the Children's Research Centers. So as you heard, we'll be working to coordinate and advance the translation of the research that comes out of these fantastic centers. We will be establishing a steering committee to guide our functions of the national steering committee and to assure its outward facing and inclusiveness of external stakeholders to really make sure that we are comprehensive in that way. We'll be working a lot on the innovation and advancing a digital hub that will integrate and disseminate the work that we do together and certainly among the centers. And we are excited to build in a new partner, ShareCare, which is the leading health and wellness digital platform company that will assist us in our communication and our outreach. And we'll be leveraging the hub's assets and interconnectivity as we coordinate and try to really align and streamline the initiatives across the centers. Next slide.
So Dr. McCauley, we'll turn it over to you.
So good afternoon, everyone. It's great being back with council, and I'm so excited about this initiative. I will be the one of the PIs for the Emory University Charter initiative, which is building on our previously funded Children's Environmental Health Center focused on the African American community, primarily here in Atlanta and in Georgia. I am so excited about advancing the science of effective communication with vulnerable communities and the scientific community, and have found a wonderful partner at the University of Georgia that this is their science, this is their work in terms of developing effective communication strategies. So our translation core is going to be headed up by Sunjuan Grayson, who will be the deputy director. Grace, you want to talk a little bit about our translation core?
Yeah, I'm so excited to be a part of this team, and we have a laboratory that tends to focus on using more emerging media technologies such as social media, video gaming, and immersive virtual reality. And what we're interested in is trying to use these emerging technologies so that we can sort of meet the audiences where they are and reach out in ways that are much more engaging and interactive, to be able to take these very important children's environmental health findings and to provide them in a way that is easy to understand, is interactive, is something that they carry forward with them and can transfer into their day-to-day environment, so that these scientific findings are not abstract and difficult to process, but much more concrete and applicable in their day-to-day lives. And so we will team up with a team of experts on health literacy and try to be able to reach the community at a level where they can take these findings and apply it to their lives so that they're able to make more informed decisions. And I don't know if we have time to play the video, but this is a quick snippet of what we are able to do in virtual reality. So we're able to take elements that you can't really see, like air pollution, for example, visualize them, create simulations where they're able to touch and manipulate objects in the virtual space and allow them to practice these behaviors that they need to engage. And so any recommended behavior that they need to engage, they're able to practice in these virtual worlds and then transfer it into their everyday lives.
So thank you, Grace. The third lead of our center that many of you on the council know is Carmen Marcet, that I'm delighted to be working with him again. He will be heading up the Developmental Core. We will continue here at Emory to lean heavily on our successful P30 Hercules Center and dovetail a lot of our efforts into the magnificent job that Hercules does in identifying and mentoring future scientists. So we'll be working closely with them. And one of the things that we're excited about is recruiting young scientists who want to learn to translate better and more effectively. And a lot of what Grace's team at UGA is bringing to the table is how to have rigorous evaluation modalities for our communication strategies. So we're wanting for our science around translation to be as strong and rigorous as our other components of research in children's environmental health. So thank you.
Thank you, Dr. McCauley. Dr. McCormick, I'll turn it over to you.
Thank you. It's an honor to be here, and I'm representing the Johns Hopkins Breathe Center, which began over 20 years ago as the Center for Childhood Asthma in the Urban Environment. And it's really an honor to be here with all of the other centers. And our center historically has focused on the health effects of indoor air pollution, as well as indoor allergens, particularly pest allergen, defining how these are drivers of childhood asthma. More recently, we've also studied health effects of diet and air pollution and how there may be interplay here, as well as how obesity may be a susceptibility factor, providing evidence to suggest that obesity and air pollution may have synergistic adverse respiratory health effects. We're particularly interested in interventions, have focused on the home environment, but also have expanded to consider the school environment as well as community level interventions. And really, this is an opportunity to take the science that our center has contributed, as well as engage with our other centers to try to translate that back to the communities that we've been working with, as well as similar communities across the country, and really translate that science into action. I'm especially excited to be partnering with Tom Burke, who's really worked from the community to the national level, a connector, a communicator, bridging health and environmental science into policy. Tom was a PI for the Pew Environmental Health Commission and led the establishment of the National Environmental Public Health Tracking Network, and brings extensive experience translating science into action. Tom, did you want to say?
Thanks, Meredith. I just want to say hi to so many good colleagues and friends that I've worked through in various roles, and it's really exciting to be part of this right now, working with the Hopkins team, but more importantly, our network of centers and agencies we're collaborating with. I think it's hopefully a turning point for implementation of our science toward practice and prevention in our communities. Thanks.
Tom will be working with Dr. Panagis Galiatsaitos and Dr. Pam Sirkin as part of the translation core. And we have three main pillars. The first is to build a Kids Breathe lung health dashboard, really using data visualization to educate and engage the communities and the general public. We'll also be expanding our Lung Health Ambassadors program, which is an existing program in our local schools that is also expanded to a virtual teaching platform with curriculum enriched for children's environmental health. And finally, we'll be developing a Lung Health Core, a volunteer network to address current as well as future emerging environmental health concerns. This will be paired with our Developmental Core, led by Dr. Nadia Hansel and Dr. Kirsten Kohler, with engagement of all of our Breathe Center faculty and scientists. And really this will be continuing a lot of the work that's been ongoing. And I feel like I grew up with the Breathe Center. And so having the opportunity to pay that forward, I think is really something that is important to all of our members. We're especially focused on building a pipeline of diverse scientists and reaching the community and the greater potential next generation of leaders from the earliest stages. And so part of the cornerstone of our developmental core will be our Catalyst pilot program that will span from high school all the way to early career stage investigators. And we'll have special requests for applications from high school students that is communicating with our Lung Health Ambassadors program, as well as call outs for specific emerging environmental health concerns. We're looking forward to building bridges and learning about what the other centers have planned and finding ways to amplify what we have planned. Thank you.
Thank you, Dr. McCormick. I'll now turn it over to NYU.
Good afternoon. My name is Leo Trisande. I'm delighted to present on behalf of a large group of investigators. We brought together expertise from 4 NIH and CDC funded centers, ranging from our P30 Environmental Health Core Center to the CDC Prevention Center and NIMHD Health Disparities Unit. And I'm especially delighted to present on behalf of my multiple PI colleagues, Drs. Lorna Thorpe and Trin Chevron. We bring expertise together, particularly in implementation science, health disparities, as well as documenting the disease burden and economic costs of many of these exposures, which can ultimately inform policy prevention. Our administrative core will be leading in support by the translation and development cores, interest groups that we hope will span the children's centers, as well as integrate membership from across a broad array of networks that are engaged in children's environmental health research, with our initial foci on endocrine disruptors and climate change. And you can see our overall vision depicted on the slide here. We can move on to the next slide. Our translation core supports those interest groups, and then with an eye towards identifying and developing pilot projects with a goal of awarding 4 each year with substantial mentorship and technical support. And we're really focusing intensively on disseminating findings using a variety of translation tools. And as I've alluded to, one area where I think we can do even better in children's environmental health is making that business case to ultimately protect children. And so the translation core will be playing a crucial role. Dr. Thorpe will be supported by her colleague, Dr. Nadia Islam, in that effort. We'll go to the next slide. Our developmental core is similar in many ways to other centers which have presented today. We'll be supporting a Catalyst program with smaller scale pilot project awards. We'll be building on the mentorship effort in the translational core, providing a broad array of resources, focusing particularly on developing diverse faculty. One partnership I'd like to highlight is with the City University of New York system, which will provide a venue, an entree to broadening the tent in children's environmental health research. And ultimately, we will be applying a very well described implementation science framework called REAIM in order to translate better what we already know into proactive action to protect children. And Dr. Trin Chevron will be supported in that effort by her colleague, Dr. Simona Kwan. Thank you for the opportunity.
Thank you, Dr. Trisande. We'll now move on to Oregon State. Dr. Kyle?
Yeah, good afternoon. So the Oregon State University's center is, we've called it the Aspire Center, which stands for Advancing Science, Practice, Programming, and Policy in Research Translation for Children's Environmental Health. I'll serve as the director with the background in environmental health sciences, particularly environmental epidemiology. And then the deputy director is Megan McClellan, who's the director of our Hallie Ford Center for Healthy Children and Families and has a background in child development and social sciences. Our mission really is quite broad. It is to support interdisciplinary collaborations that will promote evidence-informed children's environmental health activities using implementation science methodologies to yield equitable and long-lasting improvements in children's health. The primary strategy that we're going to be using to accomplish this is to really try to emphasize multi-level interventions and use the unique strengths that we have in Oregon because we believe we can accelerate children's environmental health knowledge into action using Oregon basically as a living laboratory, and then helping to promote those activities, whether they're policies, practices, or programs nationally, using some of our organizations that we have in Oregon, as well as this network of children's environmental health research translation centers. So specifically, Oregon State University is a land-grant university, and so we have the Oregon State University Extension Service. This means that we have agents in every county across Oregon that are willing to work with us to identify stakeholder needs, priorities, and also implement and test programs. If those are successful, we have the opportunity to push that out through the National Extension Service, which hopefully will rapidly allow for the dissemination of evidence-based programming. We also have the CCOs, which are a unique kind of coordinating care organization within Oregon, which is trying to improve clinical care and practice. They actually receive benefits for prevention activities, and they're willing to work with us to try to help achieve some of their clinical benchmarks. And we will try to implement some environmental health within there. We also have access into early childhood educators through the Hallie Ford Center, and we can work within schools and school-based learning to implement some healthy school policies. The Translation Center is being led by Veronica Irving, Megan McClellan, and Allison Myers. They have expertise in health promotion, health behavior, child development, and health policy. Their primary mission is really to look at stakeholder engagement and identify best practices for these multi-level interventions. So their goals are really going to be identifying the children's health research translation needs of our stakeholders and match them with the best practices, materials, and strategies. They're going to try to connect individuals and community stakeholders and decision makers who are responsible for children's environmental health. These often exist in silos, and there's plenty of opportunity to do break down those silos and work together for the goal of children's environmental health. And then they're also going to develop and administer an annual competitive pilot program, which is really to test and evaluate some of these products that we hope to develop. Next slide, please. Our development core is led by Megan McDonald, Perry Heisted, and Andy Larkin. Megan's expertise is in kinesiology, but particularly working with children with disabilities. So she has a strong emphasis on making sure that children's environmental health research translation is accessible to all. Perry Heisted and Andy Larkin both have strong backgrounds in environmental health sciences and particularly data science. So their goals really are to train interdisciplinary scientists with strategies that emphasize data science and develop new tools that we can be used in children's environmental health research translation. Their aims are to take some of these data science methods for precision children's environmental health research translation and use them, develop them in Oregon, and again, create kind of these tools that could be implemented nationwide. They also plan to offer a pilot project program and use that to promote innovative development methods to conduct, evaluate, and translate environmental health research translation. So they'll be developing some novel data science tools for children's environmental health research translation, things that can leverage social media and also enhance dissemination. Thank you.
Thank you, Dr. Kyle. I'll now turn it over to Penn.
So first of all, I wanted to thank the NAEHS for thinking of this. It's very exciting, and we are really excited to be part of the program and look forward to collaborating with all of the outstanding investigators that you've met so far and are part of these centers. And the vision for our center, as outlined here, was really derived from our work in the community on lead exposure and harm reduction, as well as ongoing research focused on endocrine disruptors, really mediated through our P30 Center that's directed by Trevor Penning. And we've established collaborations and are partnering with 8 universities across the Philadelphia area. And they're listed on this slide and include the Children's Hospital is not a university, at least not yet. Drexel University, Temple, Jefferson, Lehigh, Villanova, Franklin and Marshall, and University of Delaware. So really a diverse group of universities. Dr. Amin Chen is the co-director of the center. Amin, you want to introduce yourself and say a couple of words?
Yeah, it's great to be here and really excited about this opportunity to, being an environmental epidemiologist for 20 years and focus on children's environmental health. I really, want to see this from research to action become reality, especially in Philadelphia region. We have, so many environmental health issues and, based on our EJ communities, and there are a lot of things we could be doing. And I really, wanted to have this opportunity to support children's environmental health. Thank you.
So next slide, please. Since really the translational core is the key focus of the center, I thought Marilyn Howarth, who is the director of this core, can best describe this. So Marilyn, you're up.
Thanks, Becky. Our work is really informed by the work we've been doing in the P30 Center, the Center of Excellence in Environmental Toxicology. In Philadelphia, the poorest large city in the country, and with many environmental justice communities. In terms of some of the key programs that we plan to translate, we're working first on asthma prevention. We have very high asthma rates in Philadelphia and our neighboring towns. In Philadelphia, we have an existing, very sort of well-established and proven program called the Community Asthma Prevention Program. And it was developed by my co-director, Tyra Bryant-Stevens. Dr. Bryant-Stevens will be translating this program, basically duplicating it in our neighbor town of Chester, a very small community without the extensive health resources of the Children's Hospital of Philadelphia, where she originated this program. And we hope to do some implementation science around that translation so that we can scale this beyond Philadelphia, beyond the Philadelphia region. In terms of air pollution, we plan to work with air pollution both indoors and outdoors. Our first program and project will be working with and in the Philadelphia School District in its aging infrastructure. We are not alone in having schools that have been under-resourced systemically, leading to crumbling infrastructure in poor cities. And so our school buildings have not only peeling lead paint, but they have asbestos wrapping pipes that is in tremendously bad state, and we believe posing a risk of exposure to the occupants of the building. It's led to the closure due to parental pressure of a number of schools over the last couple of years. And we would like to apply the science of risk assessment and risk communication to this process by doing an individualized school evaluation through a risk assessment process, and then engaging with the parents, the teachers, the staff, and the students around these issues, so to better enhance their understanding and, frankly, to help prioritize remediation efforts for the school district. Regarding lead exposure and harm reduction, we have a plethora of activities planned. Our city has extremely old housing, was always loaded with cars with lead coming out of the tailpipe when lead was in gasoline, and also the site of the largest number of lead smelters in the country. We plan to scale our lead hazard identification programs so that we can know more about the where the lead exists, and also to use our very extensive network of stakeholders and partners to bring services where they're needed, get more children screened for lead, and also help to prioritize remediation and assist homeowners in actually making contact with those remediation services. We're also working in the endocrine disrupting chemical area. We plan to establish an academy for environmental exposure reduction. This is a program for adolescents, for high school students. We think that it's the right time to be teaching adolescents about where they encounter endocrine disrupting chemicals. The whole goal of the program will not only be for their own ability to decrease exposure, but also to create a deliverable that would be.
Someone needs to mute their microphone if they're not speaking.
Dr. Howarth, I think you're muted.
Yes, I think someone muted me. I'm back. The endocrine disrupting chemicals that will be discussed with students and will result in their creating a deliverable that they can then bring back and do a peer-to-peer kind of work in their own schools. We're also administering lots of pilot projects and new interdisciplinary community children's environmental health translational research activities that we hope will develop new programs from. So thank you very much, and I'm really looking forward to working with the entire group. Becky, back to you.
So in the interest of time, our developmental core is very similar to what's been outlined. We have a number of programs that we have initiated and will continue to work on, especially focus mentoring, and administer the Opportunity Award and the Focus Research Awards for pilot grants. So with that.
Thank you. And now we'll turn it over to USC. Dr. McConnell, Dr. Johnston, the virtual podium is yours.
Thank you. I'm the co-PI with Jill of our center. The theme of the center you can see here. We plan to build on deep roots in Southern California communities that we have through community engagement cores and 2 other centers with shared investigators and a tradition of co-production of knowledge with community groups involved in development of policy. Historically, our research focus has been on effects of children's exposure to urban air pollution. We'll expand on translational work in marginalized communities, addressing solutions to exposure to near roadway air pollution, to urban oil drilling, smelters, and to the largest port complex in the country at the center of the supply chain bottleneck. Jill?
So broadly, our goal is to democratize the use of scientific information as a tool to build power in environmental justice communities to be able to better address children's environmental health disparities. So for example, innovative collaborations will bring together diverse expertise to help communities reimagine neighborhoods, address air quality, and provide participatory models to engage in air pollution science, urban planning, and data-driven policy solutions. Hyperlocal journalism using messaging and social media techniques to engage local communities offers opportunities to test the impact of messaging using quasi-experimental observational approaches. USC schools of dramatic and cinematic arts will take creative new approaches to leverage community narratives to tell stories based on the science and engage new audiences. We also have a robust evaluation mechanism, leveraging communication, network analysis, and implementation science as a central feature. And so the translation core will be co-led by Dr. Tom Valenti, who's a behavioral health scientist with expertise in social network analysis and evaluation. We will draw on our scientific base to build diverse interdisciplinary teams and community partnerships focusing around 3 areas: youth engagement and community science, urban design and policy solutions, and communication and public knowledge. So the overarching goals are really to increase environmental health literacy among public and policymakers to inform action, collaboratively develop and disseminate key research findings to local and national audiences through innovative journalism, build knowledge and capacity of urban environmental justice communities to leverage scientific studies and resources, and finally, to provide tools and strategies to eliminate, reduce, or mitigate adverse environmental exposures. And I'll pass it back to Rob.
Thanks. I'm a physician and environmental epidemiologist. I co-lead the center's developmental core with Gabe Kahn, who's a journalist. The core will respond to emerging children's environmental health science challenges with Catalyst program pilot projects that are central to a career development program. The program is leveraged from a successful initiative for trainees in our existing centers to promote development of new translational children's environmental health science. Our vision of junior faculty career development integrates peer-to-peer training, applied environmental health impact assessment, and recruitment and training of underrepresented scholars from undergraduates to postdoctoral trainees and junior faculty from across the university. We anticipate that models created from the center will promote translational collaborations with media and application to other regions of the country, hopefully including other centers, and development of a national and international cadre of junior investigators through a collaboration we're quite excited about with the International Society for Children's Health and the Environment.
So now we would like to have a question and answer session. And so open it up to questions from council members. I just want to thank all of the center PIs for joining us today for this official kickoff of this exciting new program. And so if we could take the slides down, that way we can all see each other. And I'll turn my video back on. So it looks like Dr. Perez-Lugo, you have a question.
Hi. Thank you so much for the presentation, really illuminating. But when the colleagues from Philadelphia were speaking, there was a voice in the background, of someone that didn't mute the microphone, raising issues of possible plagiarism. I speak Spanish and I could understand what was being said. And I think that is a very important conversation. So I will encourage the person that was making that comment to please to come forward and explain.
I'm sorry, this is Carmen. I was speaking to someone else. I'm sorry, it was a separate conversation. So excuse me, I apologize.
Okay, thank you so much for clarifying because I was really getting worried here.
And then Dr. Goldman, you have a question.
Yes, I do. And just first, what I want to do is congratulate all of the leaders in the centers across the country, and especially NSA Witherspoon, who I think many of us know very well and has been such a leader in pulling these communities together. And I really actually do have a question for her, which is that you've got this wonderful network of expertise now, and how you're going to coordinate this to make the whole greater than the sum of its parts. We know that these centers have played a critical role in policy, the EPA, the CDC, probably NOAA and others, but how are you going to maximize, the effectiveness of these efforts across these wonderful centers, and say?
Thank you, Lynn. Thank you for the nice comments. Yeah, that is the awesome opportunity before us now. We've had one meeting so far, and we'll be meeting periodically moving forward on a regular meeting schedule. And the whole point is to get to allow all centers to better understand the assets that are at the table, the resources, the opportunities, and the gaps of how we might be able to support each other in being stronger. We, number one, do believe that the implications of the research that comes out of these centers needs to be so much more widely understood. That is one thing that we do not see enough of, right? And I think we would all agree. It's It's extremely challenging. It's not like there's millions of dollars for, sorry, I don't know why my video just shut off, but don't know why there's not like there is millions of dollars for the marketing side of these centers. So that's where a lot of groups like Children's Environmental Health Network and the network that we have stand ready to service amplifiers, number one. That's kind of the easier side of this. The other side of this will be how we come together and acknowledge the skills, the opportunities, the capacities that each center wish that they had, and see how we might be able to find
we
additional.
are having trouble with your audio, unless I'm the only person.
Uh-oh.
I can hear her.
Perhaps
I hear her fine.
turn off your microphone and start it again. That might.
No, we hear her
In the
fine.
meantime, let's move on.
Yeah, for some reason, the video just shut off on me. It says I can't turn it back on, so that's fine. But anyway, Lynn, I was just saying, I think there's vast opportunities as we start to model, where there's kind of strengths among these centers and where they have been leaders. That's an awesome opportunity to teach and bring and connect among the leadership core fundamentally. And then, of course, the research that comes out of these centers and what the implications are, public health standard settings, as well as the policy making that you've mentioned, regulatory, informing regulatory measures. There's all kinds of endless opportunities, as well as the economic, ethic, equity, and health implications to protecting children. There's so many facets of that. So much more to come. I hope in a year or even sooner, we'll be able to, really emphasize these strengths and to really articulate some case examples of how that alignment is taking action.
And then we have a question from Irva.
Yeah, I want to actually just start and just kind of congratulate, starting with NAEHS for seeing the need to really move the children's environmental health sphere away from or from the great science that's been done over the last 20 plus years of starting with the Children's Environmental Health Program and seeing the problem, which I think all of us have been, many of us anyway, have been very concerned about, which is great science out there. What's happening? How is it being translated? Why do we still have, big problems with lead? 100 years it's been known what lead does to children. So I think that was really great foresight to establish this program. And I just want to say I have great confidence that this group and particularly work I've had, collaborations I've had with some of the different funded groups and particularly with NSA and the CEHN, which is such a leader in this area very broadly. So I have sort of questions. How do you balance the sort of local projects that working with local community groups and on the other hand, policy at the state or federal level, and where's the biggest bang for the buck, and how how scientists develop the trusting relationships with the advocates and the communities that are heavily affected, particularly communities of color that are so often left out of the picture, both at the research level and at the policy levels. So, but I think this is a great group to move those agendas forward. So a vote of confidence here.
And then we have another question. Phil, you've got your hand raised.
Yeah, thank you. Maybe I missed this, but it really goes to the coordinating center, I guess. But I'm just wondering about the sharing of information, and not just within members of the centers, but actually outside of that, is in a way that collecting anything in terms of best practices and things that are actually happening in a consistent way that can be correlated across the individual efforts and perhaps used by others. So it's really a question about the data.
Yeah, I'll jump in.
There's a question about,
Please, Kim.
I'll take one shot at this. This is Kim. So we did not envision this to be a repository for the children's environmental health research data. It will be a repository. Well, we haven't discussed this yet, and I'm going to lean on NC on this, on what we will host at what site for use outside of this collaboration. So the tools, the resources, the deliverables. And we haven't structurally put that together yet, but I know NSA has ideas. We're just meeting together, but we do have some opportunities within NIEHS how to share that, and that is through our PEPH, Partnerships for Environmental Public Health Resource Center. That is where we have put materials in the past, but it is behind a firewall within NIEHS. So we're hoping to create something that's more open outside of NIEHS's firewalls, and I'm going to now let NSA speak on her behalf on some ideas that we've been discussing.
Yeah, just the bottom line there is there are a variety of different platforms. And one thing we're going to do is first talk to the centers. We want to make sure that this is as user-friendly as possible and get some best practices out there. And then also offer up, in fact, I see this being the focus of one of our very near future meetings. So we can make a decision on this, explore what the opportunities are, how challenging would it be for us all to kind of get going on that one platform, and to make sure that it is user-friendly and that it will be used by all the centers. But yeah, your point about making sure that we are kind of speaking as much as possible with one voice and using and leaning on all the benefits of the differences of the science coming out and the implications of the science is the ideal here, to have it all at one place, case examples, how it's actually being implemented, how communities are moving the science, leaning on the science, supporting the science in actual work. That's what we also hope to bring actual face, visions, voice to this work as it continues to emerge.
Great, thank you.
Yeah.
And I'm just doing a quick time check. There's about 3 minutes left, Pat. I don't know if there's other questions that our council members have.
Lindsay, you didn't note, I'll note you put in the Children's Center of Impact report link on the chat. So for those who are interested.
And we also just popped in the link just right above that for the new, it just rolled out about a week or two ago, the brand new website for the children's centers.
Well, if there aren't any more questions or any more discussion, I'll say thanks to Kim and Lindsay and all of our new directors. Good seeing those who are returning to council. And thank you for participating in this, and looking for big things to happen out of this program.
Thanks, everyone. We really appreciate
Thank you,
your time.
everyone.
Great seeing you all. Okay. Our next agenda item is a little something different, but not entirely. Rick, did you have any opening words for this, or did you want me to take this?
No, Pat, I think you've been working together with Katrina and with others. So
Okay.
Yeah, just go ahead and give some opening comments.
Yeah, so
I think overall this is being responsive to requests that have come in from members of council. And so we're going to open it up for a discussion. So Katrina, we're listening.
That was my first point. No,
Okay.
we periodically have these special sessions where we discuss an important topic related to environmental health sciences. We tee it up, and then we have some council members involved. And what we're looking for here is a thorough discussion around this important topic. Liam can do better justice to this, so I'm going to get out of his way and say, Liam, let's go.
Right. I believe. Oh, perfect. Well, good afternoon, everybody. My name is Liam O'Fallon, as Pat said, and I am a health specialist in the Division of Extramural Research and Training here at the National Institute of Environmental Health Sciences. And it is a pleasure to be here to help facilitate, to tee up and facilitate a conversation. Hey, Nathan, it sounds like you need to be on mute real quick. So I'm going to be moderating today's conversation along with my colleague, Dr. Katrina Korfmacher from the University of Rochester Medical Center. When Katrina and I set up this discussion, we outlined the following 3 goals of the conversation. We wanted to promote a holistic conversation on reporting back research results, or RBRR. We wanted to have a conversation.
John, did you hear me at all?
Nathan, you need to mute.
Thank you, Nathan. To promote this holistic conversation, we also wanted to consider the challenges as well as solutions of doing reporting back of environmental health research results and placing that in the context of the various partners. And we wanted to also give the opportunity or space to identify some possible next steps for the National Institute of Environmental Health Sciences, whether it was in the context of training, guidance language, or other opportunities. So we figured that Council, with its range of expertise, would present a productive venue for a broader conversation on this important topic. Before we begin, I'd like to give you a roadmap of the next 90 minutes as follows. First and foremost, I'm kicking this off, and Katrina's going to give a brief context in the context of Partnerships for Environmental Public Health and Council. Julia Brody then is going to give a presentation on the state of the science and the work that she's been doing in this space with Silent Spring. And then we're going to invite some council member comments from Marla Perez Lugo, from Robin Tangway, and from Edith Parker. We had asked for Dr. Robert Wright to make some comments, but unfortunately he's not able to be here today. He's spending time with family right now. And then we'll have a council discussion and then conclusions. So what is it that, when we talk about reporting back research results, or RBRR, as a colleague of mine recently published, quote, reporting back can refer to the return of research results to an individual research participant and or larger community. And within the context of environmental health, data reported back to an individual may include contaminant levels measured by research participants' bodily fluids or tissues in environmental media collected in the research participants' immediate environment. In contrast, reporting back at a community level focuses on the aggregate results of the study. And both types of reporting back often provide a comparison to help research participants contextualize their personal exposure and or the community level risk. There are several reasons why reporting back research results to individuals is important and beneficial to all research partners. Reporting back research results can increase the transparency of the work that's being done, can build the trust with the research participants. It promotes reciprocity. It demonstrates respect. It can strengthen environmental health literacy, as well as foster additional engagement in the research process. Clearly, discussions about reporting back research results is not new. The genomics research community has been talking about ethics and best practices of reporting back research results long before those of us in environmental health sciences. That said, there's been a growing interest and promotion of reporting back research in the context of environmental health science research. In 2018, the National Academy of Science published a lengthy and comprehensive report on reporting back research results, which inspired a Partnerships for Environmental Public Health, or PEPH, grantee meeting in the same year, 2018. Most recently, NAEHS partnered with NHGRI, National Human Genome Research Institute, to convene a workshop on ethical, legal, social implications of research examining the interactions between gene and environmental exposures. Topics at that workshop included collection, analysis, and sharing of environmental and genomic research data, identifying unique concerns of vulnerable populations disproportionately affected by environmental exposures, and potential legal and privacy issues. So there was a good focus on reporting back research results. So this slide is a long way of saying that reporting back research results is an important topic that has been discussed in different venues. So at the end of the next 90 minutes, after a holistic conversation, we hope that we will have touched upon some challenges and solutions, as well as some possible next steps for the National Institute of Environmental Health Sciences to advance this conversation. With that as an intro, I would like to introduce my colleague, Dr. Korfmacher, who will share her perspectives on reporting back research results and why it is important for us to be having this conversation today. For those of you joining us remotely, Dr. Korfmacher is a council member. This is her last meeting, and the director of the Community Engagement Core at the University of Rochester Medical Center's Environmental Health Science Core Center. She presented at the PEPH 2018 meeting and was a panelist at the recent G/E workshop. Katrina, I'm going to turn it over to you.
Well, thank you so much, Liam, and thank you to all of the NIEH staff, leadership, and council members for your interest and anticipated lively participation in the discussions coming up. I want to start by acknowledging that there are many perspectives on report back, and I've personally experienced several of them, but there are many others, and I hope you'll bring that to the discussion. So when we get the slides back up, you'll see that there's a long list of things that are different perspectives. But the first and primary one for me is that as Community Engagement Core Director, it's my job to cultivate trusting community partnerships. And I've been asked to facilitate enrollment in studies where there's no plan to report back results. And community partners have made it very clear that asking to invite them to invite participants under these conditions would jeopardize our trusted relationship. And so in my own community-based research on lead and housing, we've had to grapple with some of the really sticky ethical and legal and economic issues related to sharing lead dust with residents and property owners. And I've interacted with IRB members who voiced concerns about sharing results with participants. These conversations really drove home the importance of developing a shared understanding of what's appropriate and ethical report back for me. As a research participant myself, I once received a 20-page report of my household environmental monitoring results that was thorough, comprehensive, and utterly unintelligible to my husband and I, both of whom literally have PhDs in environmental science. And that experience inspired me to use Silent Spring Institute's Report Back Toolkit to try to help more effectively report research results for a future study by this investigator. And that turned out to be even harder and more time-consuming than I expected, but participants were really appreciative, and we've built on this work going forward. So these experiences and perspectives convinced me that reporting back environmental health research results is essential, and also that more support is needed to disseminate and implement these practices appropriately, which is why I read that 2018 NASM report, returning individual results to participants, all 399 pages of it, with great interest. So NASM had gathered a committee of multidisciplinary experts who reviewed the ethical and social considerations, laboratory quality issues, appropriate processes, legal and regulatory environment, and many other aspects of report back. And they issued a consensus study report that found high quality report back requires dedicated guidance and time. The potential harms of report back have been overstated, and the benefits have been underappreciated, partly because they extend beyond the clinic and beyond actionable results, and that report back is vital to building trust in research. Concluding that as a matter of reciprocity, respect, transparency, and trust, the returns of results should be routinely considered, this NASM report paved the way for wider adoption of report back. And it made a big impact on the Partnership for Environmental Public Health Group because many of its members are partners in community engaged research where report back is a core value. They've been involved in developing appropriate report back approaches for many years and in creating innovative tools to support report back to diverse communities. A growing number of us have been involved in systematically evaluating the effectiveness and impacts of report back on participants and communities, and have worked to disseminate what they've learned to other research partnerships. And they're keenly interested in supporting implementation of report back in new research areas and communities to advance environmental health equity. So after considering how it could best contribute to implementing the NASM report's recommendations, as Liam said, PEPH decided to focus its entire 2018 meeting around this theme. The meeting drew around 150 attendees and was organized around the questions of why, who, what, and how of report back. It had a particular focus on what supports are needed to do report back well, and what characteristics of environmental health research make report back in our field special. And in light of the strong interest by these PPH grantees, there was a real focus on how NIEHS can be a leader in moving this field forward. So some of the key takeaways for this meeting from this meeting were that report back is essential for successful community engagement. It's at the foundation of translation of research into practices, policies, and actions, and it's a team sport. It requires close interaction between researchers, communities, healthcare professionals, governments, educators, and community engagement professionals. Several publications resulted from this meeting, including a summary report and a paper by Erin Lebowski, Sarah Yelton, Brandy Jansen, Esther Erdai, and Melanie Pearson, which noted that despite the many recommendations to return research results to study participants, there continue to be many barriers to implementing this practice, including financial support, lack of expertise, lack of established approaches, and institutional approvals. The PEPH conference report similarly concluded that the science of report back is well established, but has not been consistently implemented. And the recommended next steps were to clarify guidelines and expectations for appropriate report back, again, with that focus on why, who, what, and how, to provide training and capacity building so that people can do report back well, and develop resources to help implement these practices consistently and equitably. The final conclusion was that for these things to happen, it was imperative to move this conversation about report back beyond PEPH to the broader environmental health research community, which is why we're so excited about sharing it with you today. So when I joined council in 2019, this strong and urgent call from the PEPH group was top of mind. And indeed, report back has popped up in nearly every council meeting I've been in. In just the last year, for example, we discussed open data and the importance of the FAIR principles, when I suggested adding one more, E, FAIR E, for equity, as a reminder to consider the needs and goals of communities that are the source of the data. We also discussed the need to support data sharing and that these mechanisms and resources could also support sharing data with participants and communities. When we discussed sustaining cohorts, questions were raised about what's appropriate report back when data is used and new things are learned long after it was collected, and that led to a really lively discussion among council. Many of our sessions have highlighted NIEHS's leadership role in community engaged research and the role report back can play in the goals of co-learning, empowering communities, providing mutual benefit, and helping to disseminate findings and knowledge. When we kicked off our council conversations about diversity and inclusion, Dr. Valentine shared a great presentation highlighting diverse researchers' interest, particularly in addressing community needs. And we also noted that sharing data with community participants may interest them in environmental health science, eventually helping to build and diversify the workforce. Most recently in November, we heard Claudia's excellent overview of the NIH Agenda for Climate Change and Human Health Research, which throughout strongly emphasizes health equity and community engagement and research. So with this setting, it seemed really timely to have a focused setting of council to discuss report back in the context of these diverse issues and the opportunities for NIEHS to play a leadership role. And I keep those why report back notes on the side there, just to remind us that it's really easy to think of all the reasons why not. Why is this difficult? Why is this hard? What are the challenges? But it's really important to stay focused on why this is so important. So in summary, the necessity of report back for successful engagement and translation has been clearly established by researchers and community university partnerships over the past 20 years. These teams have developed principles, approaches, and tools for appropriate report back of environmental health research results. And we're really fortunate to have with us today one of the leaders of this work, former council member, Julia Brody. So Dr. Julia Brody is Executive Director and Senior Scientist at the Silent Spring Institute. She's a nationally recognized expert on environmental chemicals and breast cancer, as well as a leader in community-based research and public engagement in science. As one of the leading experts in the field of report back of environmental health research results, Dr. Brody participated in that 2018 NASM report and presented at both the 2018 PEPH meeting and the recent GIE meetings Leah mentioned earlier. Today, she'll highlight some of the work she and her collaborators have done in this area and a vision for what is needed to support environmental health researchers in successfully reporting back results going forward. Thank you so much for joining us, Julie.
I saw Julie.
Just need to
Julie, are
get
you
Julia
there?
unmuted there.
There you are.
Okay, I'm unmuted now. I lost
hear.
my ability to unmute when my slides were up. Now I'm ready to see my slides again. Thank you. Thank you very much, Katrina. Let's see if I can get control of these slides. There we go. So thank you very much, Katrina, for and Liam for setting up this conversation. We see from many different directions, including the National Academy's report and many different studies in my own research, that when people donate samples of blood, urine, dust, or personal environmental samples of any kind for research, they nearly always want to know their own results and what was found, even when the health effects are uncertain. And while we don't have all the answers, we do have now substantial experience to design personalized reports that are both meaningful and useful for the participants, and also practical and value added for the study teams. I first began working on this almost 25 years ago in the Cape Cod Household Exposure Study, where we collected air, dust, and urine and tested for 89 endocrine disruptors. And within just a few days of collecting the samples, our participants began calling our outreach coordinator, asking for their own results. At the time, it was common and considered ethical to return only those results that were above an established health guidelines. So for example, for lead or mercury. But community members had initiated this study because of their concerns about high breast cancer incidence on the Cape, and they were deeply engaged in the study. So we believed that the ethical right thing to do was to share the data back with those participants. So we began designing reports, and we partnered with sociologists Phil Brown and Rebecca Altman to begin interviewing our participants to learn about their experiences. We expanded the study to Richmond, California, next to an oil refinery, and Bolinas up the coast. And that focused our attention on the equity perspective on report back and the potential for report back to share scientific knowledge in ways that could be empowering for the communities where we're doing research. Since then, we've been continuously working on these report back methods to keep improving them. We've conducted both formative research to design better and better reports, and on summative methods to evaluate outcomes. Our team incorporates epidemiology, toxicology, social science, and computer science, as well as community partnerships. We've now conducted several hundred interviews with participants, researchers, and IRBs before and after report back. We hold focus groups, advisory councils, and do observations at community meetings where reports are being distributed. And we've conducted many rounds of one-on-one user testing. This is one of the best ways we have of learning whether participants understand their reports, and then modifying them to make sure that participants are able to read them. Now that we're doing digital reports, we have analytics on how long people spend and how they navigate the information that we're sharing. I mention all these methods that have been part of our work, not because I think every team needs to do this to report back exposures in their studies, but rather to show that there is now a body of empirical research from our team and others that researchers can draw on and build on in the future. Our work extends to many different settings and study types, including the CDC Green Housing Study in Boston, public housing, a cohort of pregnant moms in Puerto Rico, women firefighters in San Francisco. We've worked with 2 Superfund centers, and we're working now with 2 ECHO cohorts. So we're using these methods in many different kinds of social settings. So what have we seen in the way of report back outcomes? When people are getting reports about endocrine disruptors or other emerging contaminants, they're learning about chemicals that were previously unknown and invisible to them. We call this the exposure experience, a concept that builds on the sociological literatures of illness experience and literatures on experience of living in contaminated communities. We find, first of all, gratitude when people receive their reports. They want their reports and are very grateful to receive them. It's well known that transparency increases trust. We do see increased trust in the research team. We also people gaining more understanding of how their data contributed to science and to community health and taking pride in that. And I have to say at this moment that any practice that increases trust in science has to be considered a major public health intervention, and those are valuable outcomes in themselves. I mentioned that people learn a lot about chemicals they previously had not known anything about, and they may experience conceptual shifts in what they think is pollution, from something that may be coming from a smokestack to contaminants in their own home and everyday environments in things they brought home from the store. People begin brainstorming about exposure reduction. They reflect on family illnesses, and they may experience a sense of toxic trespass, the idea that these chemicals are in my body and I did not give permission for that. We generally see good understanding of uncertainty. So we'll hear people saying, I wonder if this illness is related to this exposure, but I know you can't draw that one-to-one conclusion. We wondered whether it makes a difference to give people their personal results as opposed to sharing all the contextual information that we provide along with the individual results. So we conducted an experiment in collaboration with the Child Health and Development Studies in the second generation. These are women in their 50s. 40% of them are daughters of moms who self-identified as Black. They were tested for 42, their blood was tested for 42 persistent chemicals, and they were randomized to half the group received both personal and study-wide results, and half only study-wide results. We found that the personal reports drew much more engagement. Participants spent twice as long on personal reports, so they were creating more opportunity to increase environmental health literacy. Researchers have been persistently worried that report back would cause their participants to be overly alarmed. We have not seen this in our qualitative interviews, and we did not see it in this quantitative study. You can see in the green box that participants mostly reported moderate to very strong positive feelings of being curious, informed, interested, empowered, and respected, both before and after receiving reports. In the orange box, you see they generally did not report feeling helpless, scared, or worried. We did see a significant moderate increases in worry after people received their personal reports. That's not necessarily a bad thing in public health because it may motivate action. Among Black participants, increased worry was associated with high exposures. So that makes good sense. And as a reminder of our obligations to advance environmental justice. People use their results to make personal choices. They talk about changes in consumer product purchases and cleaning practices. They may take them to their doctors. Across many different studies, we see some individuals take their personal results into the public arena to try to achieve policy change. For example, participants in Northern California helped win a court case to limit a Chevron refinery. Public housing residents said their results led to better care from doctors who were ignoring their child's asthma, another unexpected equity outcome from report back. We found office workers who were the comparison group in a study of firefighters. When they received their results, they began advocating for new purchasing rules for flame retardant-free office furnishings. And we see in communities all across the country that they're using personal results for PFAS on social media and in public hearings to try to change policies. So how do you build a report? What goes into it? Dr. Maida Galvez abbreviates the answer to that. What, so what, and now what? Participants don't want just a number. They want to know what you found, whether you think it's high, where it came from, what you know about the health effects, and what they could do about it. Our first reports were handcrafted by myself and toxicologist Ruth Ann Rudell. That was not practical at scale. So we developed Derby, the digital exposure report back interface, a software framework for generating personalized exposure reports for computer, smartphone, and print. It's scalable to studies of any size, and it's adaptable to community context. We've done reports in English, Spanish, and Chinese, and you can switch out the images and the text to be suited to the research community. You can now use both computer-based and smartphone-based reports. We first developed our smartphone report for Protect in Puerto Rico to expand access in communities where smartphone is the primary access to the internet. This is a quick look at the Derby researcher interface. We're trying to reduce barriers for other people to adopt report back. This is a beta version of an online interface for building reports. We're collaborating with a number of studies to use it right now. It will have a step-by-step guide for how to upload your data and create a report. Researchers can use or adapt the headline rules and library of information about chemicals contained in Derby, and there's a dashboard for tracking the activity of participants once the reports are disseminated. Derby also has a data visualization tool that we find very helpful, not just for building reports, but also for thinking about our data in new ways. One of the discoveries from doing report back is that thinking about individual reports changes the way you think about your data. It focuses attention on outliers, for example. It makes you want to look at mixtures to see if people who are high in one thing are high in related chemicals. And so we built in some tools that make it easy to do that. We've discovered some previously unknown exposure sources through our report back work. So key features of Derby reports are personalized headlines about both individual and study-wide results. So each participant gets 2 to 5 high-level summary headlines about things that are notable in their own results. We use both text and graphs. Graphs are designed to draw on visual abilities that are less dependent on numeracy and literacy. There are environmental health literacy messages throughout the reports explaining what we know and don't know. We're hitting 8th grade level in spite of the wonky chemical names in the text. Participants are very interested in information about both individual and community level exposure reduction, so that is a major focus of reports. Report back, of course, doesn't occur in isolation. It can happen in the context where there are also community meetings, interactions with news media and social media. And we like to create takeaway resources that participants can use and share and other community members can access. So they're accessing the contextual information from the reports independent of the individual results. Detox Me smartphone app is available to anybody to provide information about exposure reduction for endocrine disruptors in consumer products. Another example is this medical monitoring guidance for PFAS. There are still many issues to consider. What are the essential elements of environmental health literacy that should be in reports? What are the proper protocols and resources for outliers, those participants who may have results that are orders of magnitude above the 95th percentile? We believe they deserve particular attention and report back. What are the best ways to help study participants translate results for public health and particularly in under-resourced communities? How should report back be integrated in clinic-based studies and medical monitoring and ultimately in clinical care? How can report back be a resource for intervention studies? What are the new methods for emerging science like gene environment studies or metabolomics? And again, how can we best lower barriers for more researchers to engage and report back? I would underline those ideas that have already been mentioned by Liam and Katrina, that there are opportunities to provide guidance, training, and resources, for example, and also to address some of the practical and ethical issues. For example, providing shared infrastructure, that's our intention for Derby. As an extension of that, right now we're working on creating a prototype that will be inside the CDC AWS cloud so that ATSDR researchers can use it. And that could also be, that kind of resource could be provided for NIEHS collaborative studies. I also do think there is a need for additional research to keep improving report back methods and adapting them for new science. There are examples of Derby reports on our website and links to about 25 publications from our team. I'm very grateful to this definitely team sport approach with many collaborators, and to NIEHS for supporting this work for over 20 years, along with NSF, CDC, and the California Breast Cancer Research Program. And I'm very much looking forward to discussion.
Thank you very much, Julia, for that excellent presentation. And now I'd like to open it up to some questions for Julia related to her presentation before we begin a full-on dialogue or discussion amongst council. So if there are any questions for Julia, please feel free to raise your hand. If we don't have any questions for Julia's, we can go to council discussion.
Liam, you do have one from.
Yep, I see Carmen's hand just went up.
Yes, I just wanted to say great presentation, and that for us, the experience of report back has been nothing but positive all the way. I mean, the participants, they get so engaged. And then we've done studies after that and done qualitative interviews, and and they talk about the experience and they talk about the information that they're able to reach through this. And it also has helped us learn of needs that our participants have in terms of education on specific substances, so that we can really bring them the information that they need for their behavior change. So I just wanted to give a shout out to Silent Spring and say is this truly the way we should go?
Thank you so much for adding your experience.
Thank you, Carmen. Other questions for Julia? All right. If not, at this time, thank you so much, Julie. We will go to
Liam.
Irva, there's your hand. Okay.
Yeah. Hi. Julia, this is really terrific. I was like just taking little notes about, oh yes, this would be. I feel like one of the obstacles is the time and energy it takes to really do this right. And I know, like 20 years ago when we started our autism studies, we had a community advisory group, and they really wanted us to give everything back to them. And we just were really hesitant because we felt there was so many chemical things. We had no idea whether they had any relationship to anything or were harmful or not. And so we opted for what you talked about as being sort of the old model, which was we did give back levels. We measured for lead and mercury, and we had some immune markers where there were some standards that we could compare to, and then did that comparison. And it was actually a struggle for me to get my team to want to send it to everybody as opposed to just the people who had some high levels. But we did. And but I, and then at our community advisory committee, when we said, well, we didn't really want to send everything back, we sort of said, well, we'll do this. And it was kind of a compromise, and they weren't really happy about it, but because these were activist people who were on our advisory committee, and they really wanted everything. And but just hearing, sort of laying out all of the positive reasons and so forth, you've convinced me now. But it is really time consuming, and I have some, I think, good intuition about communication, but really there are people who really know much more about risk communication than I do. And so what would you recommend for, how to, how to do it? And, there's also this issue of the funding that, we didn't write that into the grant, but or that kind of thing. But, obviously you can write it in the future. So.
Well, we're really trying very hard to make it more doable, not too expensive, not too hard. Derby contains a library of information about many chemicals. Sometimes a study might have a chemical that's not in there, of course, and then it would need to be added. And we are trying to keep it up to date. Trying to provide that communications expertise from our team, so that every team doesn't have to have that. And every team doesn't have to create their own report. Researchers control the messages, they control what choices there are, for example, about benchmarks. So the graphs can compare an individual's result to the study distribution, and it can show the study median, or it can show a relevant NAEHS median, like the NAEHS median for demographically similar group, for example, reproductive age women, or whatever is relevant to your study. So we're trying to make it practical, and so that not every team has to start from scratch. And we're looking for new people to work with. Right now, we're a little overloaded with partners, but by the mid-spring, I think we might be in a position to work with additional teams.
Okay.
So I see Phil, Rick, and Terry. If these are, questions, and then we'll go to the council discussion on this idea.
Yeah, I'm sorry. I think mine might be, I'm sure Julia will have input into it, but it might be best held to the more general discussion. So I'll hold for a second, sorry.
Thank you, Phil. Rick?
Yeah, let me just take my hand down here. Well, let me just leave it up. So I'd like to know, so I'd like to come out of this discussion with a decision. And so we've been talking about this for years. We've had National Academy reports. Julia just gave some very compelling reasons why we want to share the data. And so the question is, why are we still arguing this? And it seems to me that we just need to decide who is the A, who makes the decision of whether the data will be shared. Is that the PI for the grant? Is it me, the director of the institute? Is it the director of the NIH? So let's get to the heart of this. So let's start addressing and assigning who is the person that decides whether the data will be shared.
So I guess we could go to, why don't we go to our council discussion at that point, and we can start with those comments, and maybe we can get to Rick's question here of that. Unless there, I guess, yeah. Lynn, I see that you seem to be.
I wanted to address Rick's question, actually. It happened that I was the review coordinator for that National Academy's report. So I'm really grateful that people have actually used it, because that was a lot of work, all the members of the committee and all the people who reviewed it and all of that. And I feel very strongly about this issue, actually, Rick, that the responsibility is the dispersed one. but that there's no accountability. If there's no lack of people being responsible, but I don't see any, there's no requirement, for example, in grant applications that there is any kind of a plan for how the results will be returned to participants. There's no requirement. And meaning that there's also nothing in most budgets for doing this. Investigators neglect budgeting for this. And as you heard, it does require sometimes people other than the scientists to be involved. There are other people who, maybe they're social scientists or communicators or other people who can help to inform this, the kind of people that you work with who help you work with communities. The IRBs are hit and miss. My personal experience, because I've done this kind of research, is sometimes IRBs are really on top of this and make sure that my protocol is not going to be approved unless they like the plan and that they think it's ethical and it's complete and all of that. And other times IRBs just kind of skip right over it. And I really think those are the points of responsibility. I mean, at the end of the day, it's the PI, but there have to be the resources, there has to be the staffing support, and if the IRBs and the funders aren't holding PIs to account, or maybe sometimes they're deemed, it's not going to happen too often, or it will happen, but it won't be done very well. And of course, I know, and no one's going to do it as well as Julia does it. Okay, but she really has produced these practices that people can use. That's extremely helpful. And so anyway.
William.
Lynn, that's really helpful. I just, my point would be is we've got to do something different because we've been talking about this for years, arguing about this. So let's come out of this meeting with something different. So maybe it's just like we require data sharing plans, then maybe we ought to require, as part of a grant mechanism, they report back plans. And if you're specifically not going to report them back, then what are the reasons why? And that ought to be part of the scoring system for whether the grant is going to get funded. So I don't know, what's your reaction to that?
Positive on my end. Yeah, I think that we share with the rest of the academic community. Why wouldn't we share with the communities from where we collected the data and the study participants? I think it would not be difficult to write that part of the grant. The issue, though, is making sure that there's that it's planned and that there are the resources for it.
And in line with that, I think that there could be some shared resources. We created a handbook some years ago that's a little out of date, but could be updated. NAEHS could create some guidelines about report back that would help people and help IRBs to be less erratic on the subject.
So
Julia, just as a comment, it might take more than guidelines. It might take it might take the requirement of a data report mechanism.
Oh, yes. I didn't mean it wouldn't be. I think Lynn's idea that it could be part of the proposal and then would be evaluated as part of the proposal. I think that's a great idea, but just to help people make plans that are of high quality, I think some guidance and training could be offered.
And actually, people will pay attention to that guidance and training more if there's a requirement to have a report back. Actually, I see Phil has his hand up. I don't know. You've thought a lot about data sharing and report backs and various things. Want to make sure that we get your opinion, but there are a lot of other people with their hands.
So if you don't mind, can I, we had asked three council members to just sort of open it up, and I would like to sort of bring it back to them because they prepared some statements, and then we can come back, and I do see all these hands up. All right. So Marla, if you would, and then Robin, and then Edith.
Well, now I feel guilty because, it was such a good discussion that I don't know if I want to be, responsible for interrupting it.
You have an opinion. You have some prepared remarks, so please go ahead.
Okay. Well, thank you so much for listening. I prepared some notes My work focuses on the sociology of disasters, vulnerability, and the governance of critical infrastructure. So it's a little bit different than the kind of research that you are supposed to, you are used to do. We usually report back to communities, not necessarily individuals. And in that context, reporting back is two things: A, a moral imperative, and B, scientific necessity. It is a moral imperative because postmodern societies, as we all know, due to the anti-vaxxer movement, etc., are highly characterized by public's lack of trust in social institutions, including science. Just going in extracting data, most of the time from minorities and vulnerable populations, fits into and justifies that distrust. In my studies, where I conduct mainly in-depth interviews with stakeholders, I have heard this phrase many times. Why should I spend time answering to your questions if I am not going to get anything back? At the end, it's my time, it's my data. Am I giving you all this so you can boost your academic or scientific career? So let me remind the council that even in the simpler IRB rules stipulate that the good for humanity cannot overcome the individual's benefits regarding that individual's participation in a research study. Therefore, in the era of stakeholder engagement, if we want to conduct just, ethical, and therefore valid science, we need to start looking at the scientific endeavor as a long-term relationship, as has been mentioned before in this meeting. Science must be looked at as a collaborative endeavor, not only with colleagues, but also with our subjects of study. Reporting back is a way to maintain trust, accountability, and just relationships. Apart from being a moral impediment, it is a scientific necessity, as I said at the beginning. And I'm going to share a short story to illustrate that point. After the catastrophic impact of Hurricane Maria, when Puerto Ricans and me were experiencing not only a 329-day-long blackout, but also thousands of deaths due to lack of appropriate response, government response at all levels, my colleagues and I identified dozens of universities from the mainland that were collecting what is called perishable data. And one of the concepts that they were very interested in was the concept of resilience. The problem was that embedded in their research was the notion, the value, the idea that resilience was always a good thing. So resilience is good. We organized a workshop to discuss this and other issues with participation of most of the researchers and community leadership. And it was then and there that researchers realized that communities considered being resilient a bad thing, because that exonerated the government from being truly responsive to their community's needs. Under the mantra of community resilience, researchers and government were, in a way, justifying the lack of appropriate response and mitigation. I remember when members of a community exclaimed in front of caught off guard researchers, "I do not want to be resilient," as a requirement for surviving a disaster. They forget that appropriate governmental disaster response is part of my individual and community resilience. So they went ahead to conceptualize resilience as a double taxation. You must pay to live in society, and at the same time, you must pay again to be able to be on your own during disasters. And it's just recently that researchers that participated in that discussion are starting to shift the narrative on resilience, or the academic narrative around resilience, to include the concept of precarious resilience. For example, you can see Roque 2021. So reporting back in that way is a way to validating your results. So you are a student, they have the information, they have the knowledge in a way. So you are kind of bouncing back your results to see if you got it right, basically. So I have been focusing on the need to report back because that was the core of this conversation, or that what I thought it was the core of this conversation. But reporting back is not as easy as it sounds due to those very reasons and the reasons that have been mentioned. For example, the lack of public lack of trust in social institutions influence the way in which we report and the way in which our reporting is received. Because usually the public and academia does not communicate often. There is no relationship between those two sectors of the civil society. So there's a lack of understanding about what the other is bringing to the conversation. So the thing is that those skills are considered soft skills, but the research on the content of the research is considered hard science. So the thing is that right now, the soft science is getting to be more important than the hard science. So that is something that we need to put some money into and dedicate the space and the time. And please check the current best practices. There is an extensive literature on the topic that has been presented. For example, things like compensating participants as experts or as consultants, providing transportation or babysitting to underserved populations, cultural and historical sensitivity, like including translated and interpreted materials, look out for discriminatory materials, etc. Avoid using white coats or other status symbols. And that is, I think, one of the most common mistake made, because that white coat gives you a legitimacy and a power over that community and over those participants that are very probably influencing their freedom to choose to participate or not. Avoid fancy settings like hotels and or university conference halls. Visit the community, it's served well to go there instead of having them to come to you. And
Marla?
dedicate the time. Yeah,
So Marla, I think
that's my last one.
Okay, thank you very much for all those comments. Robin, I'm going to turn it over to you.
Sure, thanks. Yeah, a lot of the points have already been at least initially discussed, but I think we got to start out of the gate that, I think most agree now the importance of report back. So I think when we look at the lack of general overall satisfaction with the compliance, I think we need to focus on the barriers for it rather than assuming people are intentionally trying not to interact with the folks that they're collecting samples, for example. And I think we already touched on some of the barriers, right? Marla, you gave great examples, your practical experience of the things you need to know to do it effectively. To expect that knowledge permeates all of the expertise of the basic scientists is really probably a big hurdle. So I think, Julia, describing the toolboxes, for example, that you have available, I think that's really the way to go. I think it's a corollary to what Sri just talked about of having a coordinating core facility for doing exposures. It's kind of the same idea. There's a critical economy of scale type implementation, but even you indicated that you're overwhelmed, right? So if we really got everyone on board, lack of funding, lack of process, lack of expertise is the biggest barrier. So going back to Rick, your point, I think which seems easy to say, we're just going to put a Mandate on it. And it's taken how long since we all shared the importance of data sharing. And it's been this recommendation at the end of our grants that really doesn't influence the score. It's going to change finally in the future. But even when we get to that requirement, just from the data sharing point of view, the really gaining access for a long period of time, these massive data sets, that even for the data sharing is going to be a challenge. So I think it would be helpful to focus that most scientists want to do this well for the reasons that were really well articulated in this introduction. So how do we get scientists like me and others to really help them achieve that goal rather than shame them, I guess is what I'm saying. And then finally, there's some pockets of this expertise. So the Core Center programs, obviously the community engagement expertise, and many leverage that with other institutional resources to have this talent pool, which is around for years. Many of us lean on that, but we're fortunate. There's so many institutions that don't have the Core Center program. And even if you go to the Core Center program, they're so underfunded with the budget caps for that expertise that it's a constant battle. I know because I direct the Superfund Research Program here, trying to keep these people employed with these small budgets. So there are challenges all over the place. And so I think if we just start tackling them as challenges rather than disappointments, I think that might be more helpful. I'll stop there.
Very much, Robin. Edith?
Yeah, I think just most of what I would say has been said, but I do a couple of things, I think, building off of what several have said. And Julia, I want to point out that, you know, I remember this from the Children's Center in 1998 of how are we going to feed back this data when we don't know much. So we're so much better, in a better place, I think, thanks to Julia and some of the work that others have done. I just want to give a shout out to NAEHS, who's funded a lot of that work, and others about that. But I think two big challenges I still see is, one is that and I'm a big believer in feeding back data, but and the value of that for policy change as well as individual knowledge, and because it's the right thing to do. I still think there are things we don't even think about. And I was really struck at the LC Genes by Environment conference where they were giving an example of potential stigmatization of neighborhoods by you know, in terms of insurance rates being higher because of what you've found and report back. Now, that could also be in an academic journal. It's not just the type of report that we're doing, but I think we've got to think about those things, as well as Julia said, you know, more sort of research on how to do this better and how to do it best, and kind of in a way that takes the onus off of folks, because it is all of the issues, as somebody who's tried to do this as a researcher, of the timing and the expertise, and this coming, you know, later in the game when your results are coming back and your funding may be winding down. But thanks.
Thank you very much, Edith. Now, Phil, I'd like to turn it over to you. You've had your hand up extremely patiently, so thank you for that.
Thanks, Liam. Several others have been patient too, so we got to call in that.
I will.
I guess I wanted to make 3 points. One around the analogy to data sharing, which Rick first brought up, and then 2 points I don't think have been made. First of all, I'm a big fan of a report back. So it's just an interesting, you know, these kinds of studies are not what I would normally work on. So hearing it phrased that way and then thinking about it, it clearly makes a lot of sense. But with respect to data sharing, I think we really ought to learn, if we're going to make some analogy about requirements for report back, then I think we need to learn from the mistakes that we made with data sharing. I think the mistakes were that the policies that were put forward were, first of all, not necessarily as clear as they could be initially. And then there was no validate or no evaluation that they were actually being followed. And to some degree, that is still true. And partly that has to do with the difficulty of doing it. And so for a long time, data sharing plans were considered a joke. You could actually go on the internet, you could pull one down, change a few words, submit it with your grant, and no one blinked an eye. So, you know, that really didn't reflect the seriousness of what was trying to be done. And I think, you know, however this gets done, it should be done in a way that it avoids that. And also, of course, it has to be simple. I mean, you won't get compliance, and you also need to reward. There needs to be a good reward if it's done. You know, and I think those are things that didn't necessarily happen with data sharing. The other 2 points I want to make, one relates to the future. Really, everything I've heard about this discussion has been really around causation. So someone gives a sample of blood, and or it's gathered from their house or somewhere in the environment, and there's some level of toxicity. Well, that's really straightforward. What happens when you have all of that sort of data and then someone does predictive modeling to actually determine that in 5 years this is going to be a serious issue in your household? I'm making all this up, you get the idea. But because what you're doing at that point is introducing concepts that really are very poorly understood, more so than just basic causation, which is difficult enough. Suddenly, if you've got people doing, machine learning, just the knowledge around this space is really very limited in general. And so, there's already numerous cases where things are going off the rails. And I think there's a lot to be learned from various data science initiatives around the country where responsible data science, as it relates to predictive modeling, is being studied very carefully. And so as this starts to appear more and more in your research, I think it's something that can be learned from. And then the last point I would make is around training opportunities. What we've heard is the notion that someone gives some data and then they have the opportunity at the end of some pipeline to that it's reported back to them in a way that's either the data itself or in some larger context, which is useful. That's great. But what about using that as a training opportunity? We've talked about this from our own points of view, where the participants actually become active participants in the analysis of their and other people's data, so that they become really vested in what's going on. They get a certificate or some other kind of reward for doing that. They become it's only a small subset of the participants, most likely, but nevertheless, they become much more vested and much more educated about the work that's being undertaken. And we think about this in the context of data science, where this digital transformation of society is so profound, and the training is so far behind what people are going to need to know in the job market of the future, that it's an opportunity to use this kind of mechanism to actually train up people as they participate in these kind of studies. So those are the points I wanted to make.
Bill, would you see that that's part of the a specific aim of the grant to incorporate that training of the participants?
I would love to see a grant program that actually specifically calls that out, or it's an adjunct, it's a training component of the kinds of grants that are funding this work already. I think it'd be wonderful.
Sounds good. Very interesting ideas.
Thank you, Phil. Terry.
Hi, thanks for the presentation. Julie, I was really impressed with how much work you guys have done. It's really wonderful. I'm also very much an advocate of making sure that data is returned to our community partners and individuals as necessary. I have a question, though, that relates more to sort of legal jeopardy. And this has to do with the idea that, as researchers, we aren't trained in the law, and we might find ourselves in a particularly difficult situation where, let's say, an affecting industry or a community group or individuals might decide to engage us in a lawsuit. And it wouldn't be directly, maybe it would, but not necessarily directed at us. But these things can be kind of really touchy issues. And it was already raised about, for instance, the idea that a community member might be ostracized or their property values affected if they happen to have, by discovery, some really serious contamination issues. And have you had any people, I guess, express concerns in these areas? And it might be an impediment for certain investigators to actually consider doing report back.
Yeah, that is an issue that needs to be thought through in many different contexts. In fact, our very first grant involved a collaboration with the Harvard Law School Environmental Law Clinic, because we had discovered some very high levels of PCBs in some of the homes. And we were concerned that if we reported back those levels, it would create legal obligations for the homeowners. So there's a published paper by Sean Goho, who is a lawyer in the Harvard Clinic, saying really detailing that that was not a likely problem in that particular situation, but the possibility that it could be a problem in some situation is not unforeseeable. So I think that it's related to the concepts of stigma that have been brought up. Those are also things that you have to think about when you're doing report back. Those are important issues to grapple with. And I think like it's also interesting when you think about environmental research in comparison with medical research. If you're doing medical research and you discover some very expensive problem that a person has from an incidental finding, for example, one hopes they have health insurance or there are mechanisms for addressing that. When you are collecting environmental samples and you find a home with high PCBs, there isn't a resource for financially helping people address that. That's one of the issues that I think needs to be thought about in the protocols for outliers.
Thank you for the question.
Thank you.
Thank you, Julie. Trevor.
First of all, I want to thank everyone that's been speaking because a lot of thought's been put into this. And Julia, congratulations on your digital report back card. It's a wonderful thing to start thinking about. I had some other thoughts though that haven't been perhaps raised. One is Rick asked the question, who has responsibility for the report back? And clearly the study is always overseen by a principal investigator. But I'm of the mind that it's probably too much for the principal investigator alone to disseminate the findings. As you can see, there are many aspects to this to which the principal investigator may actually not have the expertise. And I'm wondering if a good analogy is what we do like in clinical trials is to have some kind of data safety monitoring board, but it's not safety at this point, it's a data monitoring board, which can oversee the quality of the data generated in the study and help the investigator frame the message. And this data monitoring board could actually have individuals with different expertise to help frame the message moving forward. And so this could be part of the human subject design component of the grant to actually have this board in place. And I don't want it to be onerous, whereby it holds up the dissemination of important information back to the community. But the concept is that the PI is going to need some help. And not everyone has a P30 Center. Not everyone has somebody who's really attuned in community engagement. And so I think we need to arm the principal investigator to be able to deliver the message. And then you have to ask, what is the message going to be? So Phil talked about causality, but I'm struck by going back a little bit to the Red Book of the National Academies, whereby they talk about risk communication. And one is hazard identification. One is hazard characterization. Is the exposure sufficient to cause harm? And then how are we going to manage that risk? So I think there are ways in which we can actually frame the message moving forward. So they're my thoughts on this.
I mean,
Great to
Trevor,
see you,
just
Trevor.
adding to that, you also have the is it likely to cause harm for that individual based on their biological makeup?
Right.
And that's where we talk about the gene by environment effect. So it's complicated.
Right.
I'm sorry, go ahead, Julia.
Well, I strongly think that report back is a team sport, as Katrina said, and we use expertise in epidemiology, toxicology, social science, communications. I think it's also very important not to let the PI off the hook. That the PI, the reports need to communicate what the research team really thinks. And the PI has to take responsibility for that. So they need help, but they are not off the hook.
Thank you for that, Trevor. Brad.
So
thanks, Katrina, for pushing this issue. It's for the time I've been on council, Katrina's been an advocate for dissemination for the entire time, and maybe be much more thoughtful in my grants. And Julia, thank you for your really thoughtful work, and you're helping me think about this more deeply. I will say I came into this somewhat more skeptical, although a skeptic that's being converted at some level. I do complex field-based research that looks at health outcomes, and you know, a lot of the work I do. So this is, you know, I'll use my personal context as well, like Marla did. You know, we do address issues of exposure, but we also address issues of complex health outcomes that don't, and phenotypes that don't necessarily have clinical clear implications. And as a clinician, I find it very difficult to know what to do with that information and how to disseminate that. I think that comments about I think there is a parallel to genetics in a sense, and you know, any of us who deal with complex phenotypes and trying to understand what to do with whole exome sequencing data at an individual level, I think it's a very good parallel with what we deal with you know, an imaging phenotype that has not, without a clear clinical outcome, and how you report that. So I think maybe there is something to learn there, although the methods of communication do not necessarily align themselves perfectly with genetic counseling. And I think, you know, in many cases, the individual benefits of the research that were referred to earlier may derive from the aggregate results, and may not really, it may take years of research to actually get to the point where we know what we're even trying to communicate. And then in complex international studies, and I've got a couple examples of those, you have social context that is not really necessarily aligned with the way we as Americans necessarily think about disease, and just our social context is so different, we may have to really adapt. And so we have struggled in one of my South African studies with communicating complex results in a very low educated population, and concerns about the environment being highly volatile with you know, any given weekend there may be riots that we have to take into account, with even whether we can do field work, and how that context can influence how we provide the results. So I just wanted to raise those concerns, and I think that from the standpoint of the comments that have been made about the solutions, I think cost is a big problem. I mean, in our average, you know, in our $500,000 a year direct grants, I mean, squeezing these additional components into the grant can be quite difficult. There are legal issues, and as Cindy and Kim know, I've been FOIA'd a tremendous number of times for research, and there are a lot of downstream effects of that intrusiveness of the legal system. If requiring report back to be considered as a score driving factor is something we want to do, how would that be implemented? That would have to be a trans NIH process. It couldn't be something we do at NIH, and it would almost have to be an after the fact criteria. And I will raise one possibility is maybe this should be a relatively easy competitive supplement that we offer, and you know, and a mechanism. You know, we all like extra funding on our grants, and maybe this is something, you know, a solution would be to encourage us to submit small supplement grants to be able to support this kind of work. So it's separate from the grant in the budget, but tied to the grant in the setting of it would be a net, you know, it'd be something you could compete for, but it would be an incentive for people to really build this in. So anyway, some random thoughts from somebody who does this kind of work and is still struggling with how to follow Julia and Katrina's lead on this in this area.
Thanks for those ideas and thoughts, Brad. Real good. And also from the global context. Janie.
Hey, Liam, I think Irva was next, wasn't she?
I was going to call on Janie first and then Irva.
Oh, okay, I'm sorry.
Thank you, Liam. So just a couple thoughts from my experience, mostly working with tribal communities. First, maybe as a carrot to investigators, that those report backs really provide those insights if the community does trust you as to what maybe the next steps are, what their next concerns are. And if you sort of bypass that or just send out flyers or whatever, you really miss that dialogue. So I've found that to be very, very useful in the work that I've done. And then another thing is just thinking about language. I know we've talked about, the 8th grade reading level, but also what language do these folks speak? And again, in some of my experiences, these are older folks that speak only Navajo, for example, and they don't read Navajo. So having to think through those types of things and not just translating something, say for me in written Navajo, that's still not going to hit the mark. So just, trying to think about that. And then lastly, I really do think it should be part of the grant process. The proposal process is to think through how you're going to report back. Because I really think it's an ethical issue, especially for underrepresented and vulnerable populations who, we hear time and time again, if you don't come back, then we're just guinea pigs. So just trying to keep that in mind that, they are as participants in many different ways in these types of studies.
Thank you very much, Jani, for that perspective and those comments. Irva.
Yeah, thank you, Liam. So I think there's I just have a couple of comments, some reactions to things that other people have said that I just want to put out on the table. So I'll start by picking on Trevor's comments, where he really kind of laid out the old risk assessment, framework of hazard identification, risk assessment, and quantitative determining, how big is the risk and how high was the dose and so forth. Because I feel like that there are a handful, maybe even a dozen or a couple of dozen of the things that we tend to look at in a lot of our current environmental health epidemiology studies, and where we could do that. But the vast majority of things that we're actually researching now are things that we don't have a solid grasp of what is even are they associated with any of these outcomes, and what we might have are levels in the blood or levels in the urine of excreted metabolites, and that's just that's probably not the level of data that we would have. I think it's so much more just here's your measure, here's the measure, the rest in the community. Here's what some animal studies show, and we don't really know how dangerous this is and whether it contributes to the conditions that we've measured in you or your family members or what have you. And then because there's just so much uncertainty, and I think communicating the uncertainty, it makes it harder. The burden is the more onerous on the communicators, but without communicating the uncertainty, I think we're not being true to the science, and we're not being fair to the communities and individuals that we're talking to. So yeah, I would kind of push back on that kind of approach. It seems like there's a couple of questions, and I think there was one interpretation of what Rick was asking, and I actually have a different interpretation, that he was asking who makes a decision about whether we go forward with this, not who communicates the data back to, or the results back to the community. I think it has to be coming from the research team. And it might be consultants they bring in or people they hire specifically for that, or it might be people on their team. But I think it's got to be at the local, not NIH or somebody else giving the results back. If it's all about the trust and the relationship and the transparency. And then I think there's another, the level of, education and training. Certainly the environmental health literacy is part of what what the feedback, the report back is it is raising the level of environmental health literacy in our study participants. If it becomes, and personally, I think it would be a good idea to have this as a requirement in our research grants. And it'd be nice if some of the caps on the sizes of the grants went up accordingly. So I do think it's a good idea, but I think that then requires educating, as data sharing has required, educating the scientists who review the grants to know what is a good plan and what is, and probably maybe not an acceptable or adequate plan. And that's going to require NAEHS doing, educating the reviewers that you're bringing in, and it could be webinars. Anybody hearing the presentation that Julia just gave, I think would learn a huge, just a ton, and so making her presentation as a video that reviewers and scientists who are applying, of course, would have to get started and to really understand what the goal is. And I think that not doing it, it's, people have used different words. It's this extraction. We're extracting from these communities. And the other term that I have heard a lot in talking with community groups is the parachute scientist who parachutes in, collects their data, and, gets picked up by the helicopter and shoots off again. So that sensitivity among communities, I think, is very high, and that the building of trust and transparency is paramount. And that educating the public is also the way to get to our policymakers as well, because ultimately policy changes are often the result of just so much demand by people. We don't want those products. We're not going to buy those products. We don't want this in our foods. So it's part of, I think, the translational. It's one of the key steps towards the translational aspect of our work. Thanks. Sorry. Go on.
Thank you, Irva. Especially, I think the training component is clearly critical in next steps. So appreciate that. Marla.
Yes, thank you so much for this great discussion. I think it is very profound, the fact that we are having it. I would like to comment on two things. The first one is the underlying assumption that activism and scientific work are mutually exclusive. This is a conversation that has been going on for decades, and even in the natural sciences. And I'm going to quote Spider-Man's uncle here: with great power comes great responsibility, and knowledge is power. So you have a huge responsibility towards your communities, towards your humanity in general, to fairness, to equity, et cetera, et cetera. So at least that's where I'm standing. I don't know how popular that opinion is. But the Union of Concerned Scientists have addressed this issue, and it is having a very big initiative on scientific activism that maybe will be worth to look at. And the second thing is this tension around legal obligations. It is not the first time that the nature of higher ed institutions and the nature of scientific endeavor is clashing. And me personally, I have an experience with IRB and the university that IRB, sorry. Oh, sorry. My dog. Oh my goodness, I lost it. Yes, that IRB requires the absence of exculpatory words in the consent form, but the university requires the use of exculpatory language in the consent form. because of legal obligations. So it might be worth it to look at all those tensions that has previously been addressed. And I don't know, maybe we have a great opportunity to transform higher ed.
All right, thank you very much, Marla, for those comments as well, and the various opportunities. So just looking at the time, we've got about 5 minutes here. So if there are any wrap-up questions, comments, Rick, reactions to what you've heard before we close out this session.
Yeah, well, again, I'm going to return to my interest in doing something. So I don't want to have Katrina coming back as a guest next year and saying, okay, let's talk about report back, and then come back the year after that and let's talk about report back. So what are we going to do? I want to hear something, and things get done when decisions are made. And I need to know who's the decision-making, the authority, the person who has both the responsibility and the authority to make a decision. So I'm hearing that for different grants, it's the PI that will ultimately be responsible for developing a report back mechanism. And they may want to incorporate some of the suggestions that are coming in from Trevor, and I'm watching on the chat box here, but it's going to be their responsibility. And if they decide that they're not going to be reporting back just due to the nature of the work, then they have to describe whether or not going to do that. And that should be part of the review process. But I want more discussion. So what can we do? Should we appoint a special committee of the working group to come up with some recommendations so we can bring this to closure? What are we going to do about the report back? So who would like to react to that? Katrina, I'm going to ask you, how would you like to react to that?
Well, first of all, I want to say I just met you, and somehow you figured out that persistence is one of my main characteristics. So yes, let's avoid that. I would love to see this resolved. I do think it's a long process, though, because it is a very complex issue. I think that what we've heard today is really broad support, and also some really broad principles that can be implemented, and figuring out how to operationalize those is the next step. As I said in the chat, seeing reviewers really struggling and trying to do the right thing, but a lack of guidance there, and similarly, PIs trying to do the right thing, but not knowing how they're going to be received by their IRBs. So it does seem like there is a potential to develop some guidelines, develop training and resources, much as Christy did with the partnerships and environmental public health metrics manual. That was a resource that was really helpful in operationalizing the idea about evaluation. So I think that you as an institute know how to do this, to take a big, important, hairy idea and make it happen.
Okay, and again, we're relying on the advisory committee for substantive input. And Gary Milley just put something in the chat. I think it's really important. Bad report back could be worse than none. I mean, what's your reaction to that? Anyone would like to react to that?
That there must be data about it. So instead of just trying to figure it out by ourselves, we should check what the data says.
Certainly agree that bad report back is bad, and NAEHS should be aiming for good report back, and defining what that is part of.
I would say that's why there needs to be a plan, and that's why it's important that it is developed mindfully, rather than at the end of the study, oh well, maybe people are pressuring us for the results or whatever. That it's an afterthought. It's more likely than to be bad than if it's thought through ahead of time, and considered thoughtfully with within the grant proposal, with your IRB, any other mechanism that exists.
And there could be educational mechanisms too. I'm sorry, go ahead, Katrina.
One of the first things I learned from Julie with looking at that report is that there are principles and there are practices and there are processes. And the fundamental part of the process is to build it in from the outset and to get community engagement in how to do it. There are practices that can help you along the way. But at a high level, even though your report back tool doesn't work perfectly for my report because it's not biomonitoring of chemicals, but those principles at a high level have been so helpful in just as a playbook for any other kind of research. As social scientists, we do have guidelines for how to promote and guide quality work in this space.
Okay.
Right, so I'm going to I'm looking at the clock. We have under a minute just to keep us on track. So the four of you with your hands up, 15 seconds, no more in your responses. Trevor.
So one asked the question the point was raised that bad report back is worse than no report back, and I agree, which is why I'm an advocate of a data monitoring system, a data monitoring board, to actually look at the quality of the data before it's reported back.
Okay.
All right. Brad?
So I think that this cannot be done as a cookie cutter approach. The report back will have to be contextualized and appropriate. So whatever we do, it can't be you must report back X, Y, or Z. It needs to be thoughtfully designed according to the context of the study.
Thank you, Brad. Andrew.
And Rick, I would ask you on a structural level, how is NIH or NIEHS responding to Executive Order 13985, 14008, and 12898? What is included in NIH's plans to respond to the equity executive order? Is this something that's built into it? I know for EPA, we've had to put together barriers documents as well as next steps. I ask what NIH is doing and if this is something that you can push forward as part of the structural changes that are going
Very
forward.
interesting. So Andrew, would you be willing to share the things that you put together at the EPA for us to review?
I can share some of it. It's at the White House, so but I can certainly tell you lots about it.
Okay, sounds good. Well, let's plan.
Thank you, Andrew.
You bet.
And wrap us up, Irva, 15 seconds. We're over time.
Yeah.
Sorry, Karen.
Yeah. Okay, so as Brad said, it has to be done carefully. I think in the process of trainings, the scientists, the application, people doing applications, people writing the grants, and people reviewing them, there needs to be models of this is a good one. These are mistakes you don't want to make. This is not a good plan. And I would suggest that there could be a phase in of this, where you would start with those applications, grants that already have a community component as part of them, because those are the people who should be doing it now. If there's not a community component at all, it's just somebody doing research, that may need to be dealt with in somewhat of a different approach. But I think doing everything kind of carefully, starting with take, however long, 6 months, whatever, put together a team that's going to have a plan for how to roll out such a requirement.
Thank you, Irva. Okay. I want to thank Katrina, Julia, Marla, Robin, Edith, and all the council members for your active engagement on this conversation. Really appreciate it. Pat, I'm turning it back over to you. Thanks for the explanation.
Just a quick comment before we go to Pat. So I want to actually do something about this conversation today. So I'm going to suggest that we put together a session with the director and the deputy director and some others, and I'd like members of council to volunteer to participate in that. And the idea would be to put together a framework of some action that we're going to take as a result of the discussion today. So do we have anyone that would like to, well, I'll tell you what, send an email to me if you'd like to volunteer. We'll find a time and we'll continue this discussion with the idea that we're going to come up with an action plan. It could be pilots, it could be a whole variety of things. This is very helpful. Does that sound like the right thing to do?
Yes.
Okay, sounds good. I wish we had more time. This is clearly something we just want to get beyond it. So Trevor, you're volunteering, so we'll capture the chat. If you want to volunteer, put it in the chat. Thanks, everyone.
Thanks for taking up this topic. It's delightful to be with you.
Thank you.
And thanks, Liam and Katrina and Julia for your time and your energy in this. All right. We're now going to move to a discussion by our Council Working Group. This is a group that was put together last year to deal with the issues of DEI, anti-racism. The committee has met a number of times and has made some progress. And I'm going to turn it over to Karen and let her lead us on, and some of our other members will follow after her. Karen.
There we go. Can you hear me now? I couldn't find my mute button.
Yes.
Okay. Well, all right. Thank you, Pat. Yeah, actually, this is a working group that Pat is essentially running, but with us, there's a large group of us now. And just to go, I think most of you have heard about this in the last council meeting, but for those of you who weren't here, I'll just go briefly through, and then we will have some reports from the group members. So our charge, as Pat mentioned, was to act as an advisory group to the council members, who will then act as advisory group to the leadership of NAEHS on issues regarding anti-racism, diversity, inclusion, and equity. So that's our charge. And in order to do that, we had to put together a group. So if I could have the next slide, please. Thank you. So this is our membership. There are 15 of us. And you can see some of us are current council members, such as myself. Some were former council members, some from academia, industry, government, and NAEHS. So I think we have a very broad and an excellent representation in our group to cover these areas of these issues that we'd like to address. And you can see here, Jose Cordero, Edith Parker, them, Andy G. These were former or current members of council. And then we have George Daston from industry, and we have Carmen Velas Vega, who you've heard from today, Craig Newshaper, Ken Ramos, Peggy Shepard, and Yvonne Maddox. And then within NAEHS, we have Fred Tyson, Mary Diaz Santana, Pat, Gary Ellison, and Nicole Popovich, who has been extremely helpful and supportive in this group. So I'd just like to acknowledge that and mention that to this group and thank her for that. Okay, so in the third slide, next slide, please. So what we've decided to do, and this was, as you can remember, maybe those of you who were in the last two council meetings, we were trying to figure out how to take this great big problem and break it down into some smaller parts that we can actually address. And with a lot of input and advice from all of you, we've decided to sort of break down our efforts into subgroups. And these are not mutually exclusive. They're not isolated silos. These are all, of course, interrelated. But what we decided to do, just to make it manageable for us as a small group to sort of tackle these issues, we've sort of broken them down arbitrarily, if you will, almost into workforce, funding, trainees, and community engagement. And you can see who the members are of each group. We put 3 in each with a chair. And I'd like to thank those who have agreed to chair these subgroups, Jose, George, Fred, and Yvonne. And what I'd like to do today with the rest of our time is for you to all hear what they've come up with in their groups. That will be presented to you by the chairs in this order. And they will spend about 5 minutes each going through that. And if you could hold your questions until the end, excuse me, I'm losing my voice. We'd like to have a big Q&A and all of your input at the end, because with the information, what we've done essentially is each group has come up with major bullet points that we would like to address. And then after this meeting, we, of course, as a working group, will meet again with your feedback and input, and we will actually start writing our report in a way that ties all of these groups together. So we're not going to do them as separate entities. But we would also like to tie this eventually back to the Unite. You've heard a lot about the Unite program going on. We will eventually tie it back, but for now we're trying to do it independently of that. And I think that's all I wanted to say for now. And with that, I would just like to introduce our first presentation on the workforce subgroup, and that will be given to us by Jose.
Karen, thank you. Again, for the opportunity to talk about the workforce group. And the members are Ken Ramos and Craig Schaefer and myself. And if we could go to the first slide. I'm glad that Karen indicated that there was overlap between the groups and that it was expected, and very much our workforce, we recognize that it interconnects with training and extramural funding. And so one of the first questions that we as a group, subgroup, ask is, okay, what should be our scope? And clearly we need to address both what is the development and of the extramural force as well as the intramural. And each of them bring different kinds of challenges. And in terms of what should be the focus, we want to emphasize or focus more on actionable items that could be addressed. What can be addressed in terms of short and long-term basis that could improve diversity, equity in both programs, whether it's intramural or the extramural workforce. The next, following sort of defining or trying to develop the scope, clearly there are a number of questions about baseline data. It's issues that we need to get, or data we need to get. One is size of the intramural workforce, but also within that, how it is distributed in terms of sex, gender identity, race, ethnicity, but also in terms of how, in terms of whether these demographic issues, how they're distributed in terms of the laboratory versus other activities, and also leadership roles. And we need to also get some data in sort of similar data on the extramural portfolio. And so one of the questions is, what are the sources of data, both for the external and internal workforce, but also in terms of current and past NIH employees and grantees. Next, please. So in terms of the external workforce, we looked at questions that in terms of funding and career development, that those seem to be some of those issues that actually were sort of quite evident. And the questions that we would like to consider are, what are the levers or programs that need to be addressed? And then what is the experience of those with an initial award among investigators in the diverse communities? And we mean by that, what's the success rate beyond the first initial award? And what's the pathway that leads to becoming a well-established investigator? And are there exemplars of early phase investigators moving through the academic and research ladder that also become mentors? And what are the success factors? Next one. And from the external aspects of, or the extramural research, and this actually connects to funding and training. But one of the key issues that we felt that we need to look at is the score criteria of areas that could bring some bias. Like one that came to mind is that describing the environment that clearly identifies the institution where the applicant comes from. And so some of the questions that we raised or have raised so far is should the applicant institution describe on their environment their diversity among investigators at senior level and those in leadership and mentorship? And what's the plan of developing diverse basis of research in very diverse areas? And also, how could some elements of the diversity can be blinded or unblinded? And how could it be done, whether it's the reviews are one way or the other? But also, perhaps, should the environment description include a set of criteria or descriptions of about a diversity rather than just a single observation or check mark. And I think that I have one more. And so in terms of the extramural workforce also, what are the points of vulnerability in the research career? What happens when maybe there is a gap in funding or availability of funding for sustainability? What about if there are limited potential landing points or a fair chance to diverse candidates? And also, to what extent there is an opportunity to increase role models and mentors? I think the sense is that there are few mentors from diverse communities. And then another thing that was brought up is that often those investigators that are either developing or established tend to be have like a magnet to be involved in community work as representative of a diverse community, and that to what extent that actually impacts their other, especially research work. And with that, I would like to finish and say we hope that we can have a more in terms of the questions that need to be addressed in the context of workforce. Thank you.
Thank you, Jose. And we'll take questions in the chat or at the end of our short presentations, because next would like George to go ahead with his report.
Okay, thanks, Karen. With Edith Parker and Karen Vasquez, the three of us have gotten together and talked about some ideas around funding disparities. If we can go to the next slide, this is just an overview of where we've come out, and we'll go through each of these bullet points. But it's really a matter of who is doing the proposing, what they're trying to propose, and where they're coming from that are the real issues that we've decided to tackle as a funding subgroup. Next slide. So let's talk about choice of research topic. I found this to be something I didn't know a lot about coming in, but it turns out that there is a small but very believable literature indicating that the disparity in funding of Black applicants is attributable, at least in part, to choice of topic. In fact, when the analyses have been done of this, it's really the second most important factor in terms of the disparity in funding success for Black applicants, right after track record. So it's big and important. It doesn't seem to relate to any particular topic or peer review panel. It just seems to be around the choice of topic. And of course, there's three reasons for this. One is the proposals are bad. I think we probably can move past that. The second is that the proposals or the NIH or the NAEHS mandate isn't broad enough to cover what these people are proposing. And that's something that I think really needs to be considered, as we start talking about broadening to systems level thinking. Does in fact the NIEHS's funding mandate cover systems level thinking around environmental health? And if it does, these topics all of a sudden become more germane. And then third, is it a problem that the study sections themselves don't fully appreciate what the NIH's mission is? And so each of those are questions that need to be addressed. And finally, if none of these are true, then we've got a mentoring problem. And that's where I think, again, we can start helping by providing mentorship. The other thing I should mention is, this literature is really small. We probably would want to encourage extending this to other groups, both gender, ethnicity, just to see whether this is in fact whether we can extend the observations to more than just Black applicants. Next slide. Jose already talked about minimizing bias in the peer review process, and certainly anonymization is a way of handling that. I doubt that there's, I don't doubt that there's explicit bias in the peer review process. I don't think it's based on race and ethnicity as much as I think every one of us has probably observed and maybe done ourselves this, oh, I know this person, he does great work. That's bias. In terms of unconscious bias, that is almost certainly going to exist. And so I don't know whether, in fact, there are systematic strategies to train in unconscious bias, but certainly the peer reviewers that NIH uses should have some unconscious bias training. And as Jose said, we should consider anonymizing the review process itself. Next slide. Jose also talked about the research environment scoring aspect of vetting proposals. And so his working group had some ideas on it, as did we. It's very likely that an individual from a large research university is going to score better on this than somebody from a small institution. And so we wonder whether this should even be scored. Instead, it's just, if it's adequate, it's adequate. It doesn't need to be 5 out of 5 or 4 out of 5 or something like that. It just needs to be adequate. And then, we are aware that many small institutions have agreements to use equipment and space at larger institutions. Is there a way to expand this? Next slide. And then finally, this doesn't really have to do per se with the funding thing, but we think is a big issue that didn't fit anywhere else. And it's around advancement of women. And it's the dilemma around parenthood slowing career development. And just we're just throwing it out there as something that is, I think, dealt with in different ways in different institutions and not dealt with at all in some. And so we just want to throw it out there as a problem of leveling the playing field that we can discuss more. Thanks.
Thank you, George. And I would just like to add to this about our discussion earlier today on training and spending more on training, which is a great idea. But I think the comment was made in the chat as well, that training is one thing. And if we can train our graduate students and our postdocs, that's great. But particularly with women, but also other groups, the bottleneck is really at the postdoc position or advancing up in academia or in industry to high levels. So I think we really need to think about that. So we can train people, but we have to think about how then to move, have them move on in advancing using that training to actually advance their careers. And this is what a bit of what George was getting at here. Okay, thanks, George. Fred, you're up.
Okay, thank you. I'm going to start off, good afternoon. I'm going to start off a little bit differently. I'd like to kind of introduce the members of the training subgroup to you all this afternoon. First, I'm going to start with Dr. Mary Diaz-Santana. Dr. Diaz-Santana is a postdoctoral fellow in the Biostatistics and Computational Biology branch in the Division of Intramural Research here at NIEHS. The underlying goals of her research really are to lessen the burden of breast cancer among racial and ethnic minorities. Dr. Diaz-Santana has been at NIEHS for 3.5 years. And as a current trainee, I think she's going to bring some unique and valuable perspectives to this group as we do our assessment of diversity within the NIEHS training programs. Dr. Andy Shih is a former council member, as Karen pointed out. He just recently retired from council, I think last round. And he currently serves as the Senior Vice President for Health and Inclusion at Public Health and Inclusion at Autism Speaks. Health equity has really been a driver for his career as he spent the better part of the last 2 decades working in underserved communities, both domestically and abroad. Throughout his career, he's been able to develop a keen appreciation for the central importance of representation and capacity as drivers of sustainable change, which is certainly something we're seeking to do with the work of this council working group. And then lastly, I'm Fred Tyson, as Karen mentioned, and I work in the Genes, Environment, and Health branch here in the extramural division at NIEHS. And through my work as a program officer, I come in frequent contact with trainees, both that are in my portfolio, as well as others who are supported by our diversity supplement awards, as well as then also having the opportunity to interact with trainees one-on-one at the various different society meetings. The reason I brought up some of our backgrounds is the three of us all have, at some point in our careers, been underrepresented minorities in training environments that weren't built for people that look like us. So we're going to be able to contribute some things in addition to the data that we're going to analyze. May I have the next slide, please? So this committee's function is to determine how well NAEHS is performing in training underrepresented scientists for the next generation of environmental health scientists. And we're going to make recommendations on how we might improve that support. We want to characterize who the underrepresented trainees are that we're supporting. Now, we're not going to be able to share individual information with you, but we are going to be able to do some analysis of some demographics. We're going to have to get some clarity from Christy Drew in the programs analysis branch about what we're actually going to be able to share with you, but we will be collecting this data both for our extramurally supported trainees, as well as those who are supported by our intramural training programs. We want to know also what kind of science these trainees are engaged in. I thought it was interesting what George just pointed out on his slide in terms of investigators being their ability to secure grants may be hampered or hindered by what actually they're proposing, the field that they're proposing. So we want to know what kind of studies are part of the training experience. Then additionally, we'd like to know if we have any issues on actually recruiting trainees from underrepresented groups. Are we having any issues with retaining them? And then also, what might be, are there any disparities in terms of placement of these trainees? I think Karen just pointed out again, after the postdoc, what happens? So are there things that we might be able to address with placement of trainees after their training experiences have ended? May I have the next slide, please? So I'm not going to read through this slide, but there are a number of activities that are managed by the extramural division, the intramural division, as well as the Office of the Director that really promote and foster diversity amongst the trainees that we are supporting at NAEHS. This list is not exhaustive, but is representative. We have a number of different programs going on, and we're looking to see how we can enhance the experience through these programs. Some of them we probably need to market a little more aggressively so that we can broaden their utilization. Okay, may I have the next slide, please? Lastly, this is a slide. This is not new data. This is old data that was actually presented by Carol Schreffler at the Environmental Sciences Health Fest back in 2016. And this is just, again, an example that's representative of the type of data we're going to be presenting to you or we're going to be analyzing. This one is really just looking at racial and ethnic distribution for diversity supplement awards that were made between 2002 and 2016. What I bring your attention to is the lower left panel where you see the award rate is 63% for that time period. The only thing that I would tell you now is as of 2021, I believe our award rate at this point is around 84%. So I think we're clearly moving in the right trajectory with regards to that. So at this point, I think I've exhausted my time and I'll stop so Karen can move on to the next person.
Thank you very much, Fred. Okay, last but not least, certainly not least, is Yvonne Maddox. And she's going to talk about community engagement. And then at the end, we can have just an open QA. So we have time, I think. So go ahead, Yvonne, take your time to present your
Thank you, Karen. Yes, I'm delighted to have an opportunity to work with my subgroup, the community engagement subgroup, on this important topic. Our subgroup members are Dr. Carmen Velez Vega. Dr. Velez Vega, as you all know, is professor and director of the Community Engagement Core of the Collaborative Center for Research and Health Disparities at the University of Puerto Rico. And Ms. Peggy Shepard, and Peggy is the co-founder and executive director of We Act for Environmental Justice. And Peggy was a former member of the NAEHS Council. I'm Yvonne Maddox, and I'm a longtime federal employee. I worked at NIH for nearly 20 years and with the Department of Defense, and had the distinct honor of serving on the NIEH Council as an ex officio member. We're delighted to share with you some of our thoughts on community engagement. In fact, as you all are aware from our conversations today, community engagement overlays all of the other subgroups: training, research, and funding, as well as the workforce. So could I have the next slide, please? We spent some of our time really deliberating on who was the community, particularly as we began thinking about this particular topic. And we discerned and decided that we were going to use the NAEHS definition that it uses in all, if not most, of its RFAs, specifically saying that the community refers to populations and groups who are affected by environmental exposures and their outcomes, health-related outcomes. We also spent some time thinking about how we could be perhaps a little bit bolder in our recommendations or in our work. And we wanted to know how community engagement actually impacted diversity, equity, and inclusion, which is part of our working group, and of course the idea of access and acceptability. We realized that we were going to need some information, we were going to need some data, and Ms. Drew has been very willing to share data with us once we began to consummate where we want her to go. But one of the things we did do early on was to get 15 years of the NAEHS strategic plans so we could get a sense of where the Institute had been in the area of community engagement over a period of time. Next slide, please. We had some underlying principles, and you've heard about many of them today. The core element of research involving the community must engage the community. That's goes without saying. We also recognize that it is the community who not only can show the researcher and tell the researcher what its own health needs are, but actually be participatory in that research by also ensuring that the researcher understands the community and understands the community's priorities. We also wanted to make it clear that community participation is really based on the belief that those who are affected by a decision that might come out of a research project has a right to be involved in the decision making. And lastly, we believe that community engagement involves its own framework, and we heard a lot about the community engagement framework today, but it also requires a peer review framework. And this goes hand in hand with some of the discussions we've had today, specifically when it comes to evaluating research that engages the community. What does the peer review team see, and how do they impact what they see, how does it impact on their scoring and their outcome? Next slide. We also wanted to make it clear that it is community guided research. It's not just community engaged research, but it's community guided engaged research, which means that you're going to be looking at various populations, genders, ages, across the lifespan, but you are going to be also looking at who's conducting this research. So we want to have some discussion around who the PI is, who is the director, what is the culture context for which this director or leader comes. We also wanted to be sure that we could do more to enhance community engagement. Next slide. We want to focus on how NIEHS might be able to do more to enhance community engagement. And that's not to take away from the successes that NIEHS has already had, and we've heard some of those successes today. But we do think it's important to do a survey of the current NIEHS research and training program to get a sense of portfolio analysis of the community engagement portfolio, to determine which underrepresented minority groups are included, what are the goals of the projects, of course, and also what is the racial ethnic status of the principal investigator or the directors of the program. We also believe that if NIEHS has had, and we do believe they have, had some success in community engagement projects, what does success look like? And how is success measured? We heard today a lot about many of the successful programs, but what determines that they were successful? There's other programs across NIH that have community engagement as part of their research agenda. The NICHD, which is where I got most of my career at NIH, launched, as well as the National Institute of Nursing Research. Both have academic community partnerships program that were established over a decade or so ago. How have those programs fared and what types of successes have they seen? And Pat was so kind to tell me about the Research to Action RFA that NIEHS put out just over a year ago, and how that program is established and what are they looking to measure as success in that Research to Action plan. We also believe that it is important, and Karen mentioned it a few minutes ago, that NIEHS collaborates with the NIH-wide Unite initiative. And I understand from Rick's introduction yesterday that Dr. Trevor will be participating in the Unite initiative. In fact, he is on the Unite committee. And one of the committees that has done something that I think is quite unique and different, the E committee, which is focusing on the extramural component of NIH, is working to promote extramural institutional culture change. And I've heard several of the NIEHS council members talk about culture change, institutional culture change. And one of the things that that E committee has done is to suggest two new types of initiatives and grant programs. One is to create excellence in diversity, equity, and inclusion investigator grants to reward investigators who have been supporting these efforts for years and engaging in diverse populations and communities in research. And then second, to launch an awards program for institutional innovation and enhancement in diversity, equity, and inclusion. Last slide, please. So where are we going with our priority topics? Well, we thought that we should be looking at the gaps that the council working group wanted us to take a look at. The charge was, where are there gaps in research related to how race and ethnicity affect responses to environmental exposures? The other was to look at what factors causes inequity in funding across the various racial and ethnic groups. So the first thing that our three-member team came up with, and of course we're delighted that now we're working with our other subcommittees, so we want to get impact and input from the other three groups, but we want to suggest that NIEHS considers adding additional council members who represent community health leaders as part of their council roster. I know that there has been some in the past, but there needs to be at least one or two on the council that certainly would help with concept clearances and other funding opportunity announcements. We also would suggest that maybe NIEHS would work with other ICs to develop more funding opportunity announcements that really engage the community leaders as PIs or co-PIs. I do know that that was a case in several mechanisms prior. A few years back, NIEHS did have a program in which leaders from the community or community engaged investigators, I guess, were co-PIs. I'd like to suggest that we discuss that and consider it. And as the other two subcommittees have recommended, I really do believe we should find our way clear to do more with historical Black colleges and universities, Hispanic serving institutions, and tribal colleges to get them more engaged. Develop internships and fellowships. We heard something about that today in terms of training, because we do need a new and diverse cadre of investigators in the area of environmental health sciences. We have some, but the numbers are dropping off the edge, as they say, and we need to add additional members to that cohort and to that pipeline. Develop initiatives that are going to engage more peer reviewers in reviewing proposals that have community engagement components. That'll help us a lot, I think, with what we heard today around reporting back. But if you have a community engaged proposal that certainly has a huge component or component involved in community engagement, it really has to be peer reviewed. And then last but not least, we think that there needs to be a matrix for assessing the impact of community engagement in promoting diversity, equity, and and inclusion. And we have a suggestion of how that matrix might be designed, and we'll be working with the rest of our committee to figure that out and to delineate some specifics. Thank you.
Thank you, Yvonne. So with that, we have about 20 minutes, I think, remaining. We would really very much appreciate any comments, feedback, questions for the group, thoughts, because like I said, after this meeting, we will all meet, our working group will meet again and actually try to start finalizing our pieces and putting it into one big plan of action. When we need to obtain some data, of course, as Yvonne mentioned and others mentioned. But once we do that, we would like to just get right on with this and give our comments and suggestions back to council, who can then give them back to the leadership. That's our charge. So it would love your help with that. Are there any comments, feedback, input, ideas, questions?
Well, just Karen, I'll just comment. I'm really blown away by how comprehensive the reports back were and the different topic areas that you're covering. I'm really impressed. I look forward to next steps and getting more substantive recommendations coming in from the committees. Boy, you've done a really great job in a very short period of time.
Thanks. Yeah, we've been working hard. We've been working together as a group. Pat, did you have a question or a comment?
It's kind of just more of a comment and adding on to what your request was for input. What you were presented was by the groups was intentionally broad and aspirational. A lot was put out there. Clearly, not all of this can be done. Even some of the data that are being suggested will be very difficult, and require a lot of effort to pull. So we would I'd like for people to kind of give some suggestions to the committee about what areas, if we're going to focus our attention, what are the specific areas that you think really need to be leaned into, so we're not going in all directions.
Yeah, actually, Pat, if I could just chime in here, there are a number of things that your subcommittees are addressing are things that are under intense kind of scrutiny and working that we're working on internally as part of and Trevor is not just a member of the Unite, but he's the co-chair of the I committee. And so he's been working pretty intensely with leadership at the NIH. So we want to make sure there's not kind of duplication of effort. So is there a way of cross-checking? So if there are things that we're working on really intensely internally, we want to make sure that you could be focusing on some of the other things that could uniquely bring contributions back to us. So I don't know, is Trevor on? I'm just wondering if he has any thoughts on this whole area.
I am, Rick, and I'm happy to share some. I'll move up to the front so it's easy.
There you go. Yep, thank you.
With the raise hand feature. Thank you. Yes, as you said, and I will also concur that it looks like the group has been doing a lot of work. There are a lot of areas clearly of overlap. I put in the chat a direct link to the Unite website. And Unite, of course, is an NIH-wide activity. And we have 5 committees which overlap substantially with the working groups that you've organized. So I would encourage you to look at that, because there have been obviously a tremendous number of things that we've accomplished already and are ongoing. In addition, there is a group which we have put together, actually came from the I committee, called the NIH Anti-Racism Steering Committee. And this is a self-assembled group of approximately 500 NIH staff who are working on various aspects, and again, breaking into 13 subcommittees that have some substantial overlap with the committees that you have there. And their work is also posted in part on the on the website. But to, I think the point that Dr. Vasquez indicated at the beginning, this group has worked essentially independent of that process. And so I think there's a great value to have that complementary addition. There'll obviously be some overlap. And so, for example, some of the data, some of the specific approaches, things that you've heard about during the council meeting, such as the first cohort, which is again an effort that came through the Unite initiative and funded through the Common Fund. And so there are things where we share very similar approaches. And so I look forward, especially in this additional role as Deputy Director, of being involved in this process. And as some of you may be aware, Rick and the senior leadership have made a very strong commitment to the development of an office that's focused on addressing DEIA activities across NAEHS. And so look forward to expanding upon that at a later time. But again, I'm very impressed with what's been done, familiar with significant amount of it, because I know some of the local individuals that are involved. And so I applaud this effort.
Yeah, I mentioned in my report yesterday that we're, and Trevor's taking the lead on developing the REAP plan. And I'm thinking that many of the topic areas that you just discussed in your subcommittees can be very influential in developing that REAP plan. Because once we have that REAP plan, that's the document that really defines what are the things that Rick and leadership, and what are we going to be doing to impact change, both at NAEHS and within the broad-based environmental health sciences community. So it's getting some intersection with the work that we're going internally with the work that's going on externally would be really important.
Yeah, thank you. And thank you, Trevor. I was really excited to hear that you're taking yesterday about that you're taking that on. So I think that one thing that would be quite useful, and as I mentioned, we did want to do this independent of Unite because we wanted to have, ideas to see how much, and it's great that there's overlap because that means those are important ideas, right? So, but we have some things I think that aren't maybe exactly the same, and our focus is for NAEHS specific, or for environmental health research specifically, that may be slightly different. So I think what would be really helpful, Trevor, if you have the time and are willing, if you could meet with our working group at some point, and some point soon, before, like we said, before we duplicate efforts, if we could meet and sort of see where, so we can read what's, there with Unite. But I mean, as far as we don't know the inside workings of what you're actually focusing on and doing there. And I think that would be really beneficial for us. And that way we may be able to just do sort of see what's already there, and we can take those things out. Things that we have that are slightly different or new, we can really focus on. And that would help us narrow down, like what Pat had mentioned we wanted to do. We want to sort of focus because we wanted to go big and have a lot of aspirations here because it's a very important topic. And so why not think big? Yeah, you only can maybe make small changes, but you can have really big thoughts. So that was our goal. But now we do need to come to a point where we can, provide advice for the leadership, for the council, for the leadership that they can actually implement. So we do need to narrow down now a bit. So it would be wonderful, Trevor, if you could meet with us and look through our bullets and see which ones we should narrow in on and which ones are sort of already covered, which ones we don't know about that you're focusing on internally that maybe we could work on together to expand.
Sure, absolutely, Karen. You're quite correct. Is that the United, of course, as I mentioned, is a trans NIH, and so really focused on all the ICs. But we're absolutely those bubble up from what happens at the individual ICs. And as Rick mentioned, I think the area that will be really most applicable is the work that we're doing with developing the racial and ethnic equity plans, which are NAEHS specific in terms of our plans. And so therefore that would, I think, be a strong overlap, and absolutely be happy to meet with you when we, as early as we can arrange a time.
That would be great. And that way you're looking at that data, the data sets, right, to know how to move forward. We were interested in those data sets as well. And so maybe we can sort of actually work together rather than, duplicating efforts. But thank you very much, Trevor. It's good to see you again, by the way. I haven't seen you in a while.
It's been a little while. Thank you.
You'll be seeing quite a bit of him.
Anyone else have any comments?
I was just
Lynn?
going to make a, yes, Karen, I mean, I think it's actually really helpful areas where there's independent confirmation from your group. You know, whatever, as Trevor and his group are trying to move things forward, I don't think that we should kid ourselves about how easy it's going to be for them to do that. And I think being able to point to this council, your working group, the fact that there is a very strong external support for many of these things could be helpful in terms of actually moving things forward within the NIH. And that's not to be disrespectful of the NIH. I know how hard it is to change existing organizations, especially really successful ones like the NIH have the hardest time making changes. So I would say, you know, Trevor, you know, you can point to them as, you know, they're the gorilla in the closet that's going to come out there unless they're able to make some real changes.
No, absolutely.
Thank you, Lynn.
One of the things that and Rick is aware of this that we've been able to do from the initiative is actually make it a part of the performance plan for the NIH director and others. And so therefore, the way that we are evaluated as leaders at the NIH system is dependent upon our ability to achieve results in this area. So we are absolutely recognizing the challenge in making these changes, but very optimistic at this time that we will achieve some progress. But it is as Marie Bernard, the CAUSEWAD at NIH likes to say, it is definitely a marathon of activities.
Andrew?
Find my buttons. Yeah. After a workshop, gosh, it's now a couple of summers ago, on environmental aging and biomarker research, a group of us got together and wrote a commentary talking about biomarkers and advancing racial health equity. And in that commentary, we actually address many broad issues, including peer review. And so on your peer review bullets, you include the importance of bias and perhaps unconscious bias. But in this commentary, we raised an additional issue, which is really engaging experts who understand the social and pathophysiological mechanism of racism when evaluating manuscripts. So when race is in there, do we have people who can critically request explanations where race is defined as a biological construct rather than a social construct, or positing a genetic basis? So being sure to engage the expertise, you know, when race is included in your study, it should be incumbent to explain what do you mean by that? and the reviewers should be there and ready to ask for that. So I think it goes beyond bias or unconscious bias. It goes to having explicit expertise in investigating these things. So I might add that to your bullets there.
Thank you. Yeah, I'm writing that down. That's an excellent point.
Just kind of picking up on Lynn's comment here. I mean, there is value to having kind of Lynn and Karen's comment, I think, you know, having this independent assessment without being biased from the internal discussions of what are the things that are really important. So maybe we want to be careful that we don't bias you too much with any internal discussions. Although as I'm listening to some of the points that you're raising, you know, I realize that we've been talking about these things really intensively and coming up with some pretty creative ways of addressing them. So I don't know if there's a way of communicating some of that information, or maybe we shouldn't. Let's let you come to your own independent assessment from the extramural community.
Yeah, I mean, I think before we, go ahead, Yvonne, did you have a comment?
No, I was just going to mention, now, Rick, you know, you and Pat have your own peer review organization, but CSR has its own guidelines for peer review. One of the things that we've talked about, it's time perhaps for NIH to look at developing a whole new peer review resource guide for how to do peer review, not only peer review of applications that may have community engagement, but the issues that Andrew just raised around racism and discrimination. Those are things that need to be looked at in context of the peer review framework. And perhaps NIEHS could spare some discussion for NIH Central around that idea.
I like that, Yvonne. I unfortunately I didn't give Alfonso Latoni, our scientific review branch chief, any warning, so I'm not going to ask him. But CSR Works has talked a lot about this. Noni Burns is the director. It would be good to hear maybe at a future meeting some report on what they are doing. They have had the anonymous review, and there's been some feedback on that. I'm not sure how positive it's been. I know they have requirements for including minorities and certain racial and gender diversity on committees, distribution. So, but I'm hearing more and more that the actual reviewers are just kind of displaying some less than wholesome responses. And I haven't been in peer review in a long time, but so I mean, it would be worth maybe sometime bringing that to one of our council meetings for discussion.
Yeah, Yvonne, that's been just an intense area of discussion amongst the IC directors and across the NIH, across the Unite groups. And there are some interesting ideas that are percolating up. I mean, law we can't make funding decisions based on race. But there may be other ways that we can tease out ways to try to address some of the unconscious bias, which is clearly there. I mean, the data points to unconscious bias. So it's interesting to some of the things that are percolating up.
Sounds great. I think that Edith has a comment or a question.
Yeah, and I think with that, we mentioned the environment section of the review process, but I think we could also look at some of the others. I know talking to folks who do research to action, community engagement, if you're doing, say, implementation, or you get dinged by folks who may not see that as innovation, and in fact, it may be, because it may be addressing this health issue in a different way. So I wouldn't stop at the environment if we're going to dig down deep. I hate to give us more, but I think that's something important to think about.
Well, that has specifically been an area of pretty intense discussion amongst the IC directors. So I want to be careful not to bias you on your recommendations, but it's something we recognized that we have to take that on.
Lynn?
I was just going to say, but I think I've said this in one of these meetings before, but other people, not scientists, and I don't know why scientists wouldn't have this bias as well. It's been shown in research that if you just change the name on a resume, and if it's a name that's recognizable as a female name, a Hispanic name, a Black name, if the first name is Shanika instead of Susan, or that it makes a difference in how people evaluate that, everything else being exactly the same. And I don't know why scientists would be any different. I really don't. We believe we're objective, but we're humans too. So.
Well, we've had, and many of us internally have had the unconscious bias training, and I'll tell you, it's pretty sobering when you look at the data. Unconscious bias is real and it's dangerous. So we've got to figure out, how do we neutralize that?
Yeah, and it's an
Part
issue.
of it is just bringing greater awareness.
Awareness, because even putting people on groups, we have this many women, this many underrepresented men, they still don't get the same treatment on the committee or in the group. They're still not considered in the same way. We could go on and on about that, but yeah, it's something that we just need to change the environment and our understanding. Yeah. George, did you want to say something? No? Okay.
No, I'm in complete agreement. So
yeah.
I mean, it sounds like, Rick, that the unconscious bias training isn't systematic, either intramurally or certainly in the study section. So that's an easy recommendation to fix.
And the training helps you identify and become more aware of it, but there's no evidence that training fixes unconscious, because unconscious is unconscious. So I think that we can identify that it exists, but that's not necessarily going to be the remedy. We see it, by the way, those same biases show up in course evaluations by students and how
Yes.
students receive lectures. You know, two actors give the same lecture, and if it's male or female, or if the person is Black or white, there's a completely different response.
And to the way that they dress, if they're female, but not if they're male.
Female, well, but if females give the lecture, by the way, the students are more likely to say that that was well organized, and when the man gave it, it was brilliant. So you know, that's galling.
It's so sobering when this data comes in, and you know, as scientists, we got to pay attention to the data. The data is solid. It's sound, and this happens. So it's a challenge. Well, thank goodness we have smart people like Trevor, who are the co-chairs of the I group and the other groups, tackling, coming up with definitive things that we can be doing to address these. And thank you, Karen, and members of your committee and the subcommittees. It's great. I see Irma's got her hand up.
Yeah. I was just going to say, you can go through the training. And then, I don't know, I just, there's a lot of different centers and departments and so on and so forth that are doing, having presentations about unconscious bias and all of that. And every time I hear one of those, it's like another little light bulb goes off because it's not a single training. It's an ongoing re-education and just, I'm constantly discovering how ignorant I am. I found this reading. I've been looking for this original work that W.E.B. Du Bois had done, looking at the Negro in Philadelphia, came out in the early 1900s. And I realized that I had not ever quite absorbed that slavery was going on in the North for 200 years before it was actually, before legal action was actually, before laws were changed in the North. And it's like, how could I have not known that? But, so there's just, it's really got to be a continuing education and not a one-time, one-off.
If I could just make a final remark actually about and what I think is one of the intents behind the Unite Initiative, which is the idea that what we're trying to do is actually to change culture. And that's actually much more difficult. So training and exercises, seminars, webinars, they're fantastic, they're helpful, they're useful. But I think that the phrase is that culture will dominate over all of these features, and until we can make substantive changes in our culture, we won't have the success that we need to have. And so, one of the hopes by this comprehensive approach is that we will actually begin to do things that change the culture. So, I completely agree with the comments you made, Over.
Thanks, Trevor. So Phil, can we make our last comment? We're running out of time, please.
And before we run out of time, I wanted to thank everyone for the feedback. This was great. And thank, of course, the working group.
So you want to finish up? I'll send a note by email. It's fine.
Okay. Well, thank you. That actually kind of was what I was going to say, is that I know this is the end of the day, and people are tired. If you have more contributions, anything you want to add to this, please feel free to email me. I'm sure Karen would be glad to hear it. This needs to be an ongoing council conversation. So with that, I will also thank Karen for leadership of this group and for the people who participated and presented today. And if Rick, if I may just kind of quickly say thank you to the people who made council work. Liz McNair, of course, who always does such a great job, assisted by Rosemary Moody, and the IT AV people, Nathan and John, who always make it look very smooth. And I also kind of want to give a special thank you to the 5 retiring members. I have really enjoyed personally working with you all. That's Katrina, Edith, Brad, and Robin, and Bob unfortunately couldn't be here. So thank you all for your time, and it was really a pleasure working with you all. In fact, I'll turn it back over to you, Rick.
Okay, well, Pat, there's one final person that needs to be thanked, and that's you for stepping in as the acting director of DERT and doing such a marvelous job organizing the the whole council meeting. So we deserves a round of applause, along with the others that Pat mentioned. So round of applause to all of you for putting together a wonderful meeting. And thank you for all members of council. I found this to be a very engaging, very energetic discussion. And just remind you that one of our leadership values is communication. And part of that communication is developing more robust two-way communication. That's what I want from council. It's not just coming 3 times a year and listening to what we're doing. You're working with us. You're an advisory council to me, to senior leadership, and together we're going to make some things happen on behalf of the environmental health sciences community. So thank you all, and so have a good evening.
Thanks a lot. Take care.
Take care, everyone.
Thanks,
Bye.
everyone. Bye-bye.